Good morning, everyone. Welcome to the Daru Disability Disaster Resilience Forum. My name is Melissa Hale, and I am the coordinator of the Disability Advocacy Resource Unit, and it is my pleasure to bring this forum to you today. Before I begin, I would like to acknowledge the traditional owners of the land on which we all meet and pay my respect to their elders past, present, and emerging. We are now living in a new world with a new normal due to COVID-19. Like all of you, Daru has had to review its program and the way we deliver our programs to you. We know that the discussion we are about to embark upon today is so critically important, so we are pleased to be able to still bring this to you safely and online. We encourage your active participation today. Please type your questions in the Q&A box, and at the end of each session, I will be facilitating a Q&A session with our presenters. If you are on social media, please use the hashtag DDRForum to keep the conversations going. If you need to access the closed captions for today, please see the chat box for the closed captioning link. I hope you've all settled in comfortably with your blankets and slippers and warm cups of tea, because we have some fantastic presentations and some great presenters. And in true Daru style, we also have some fantastic music for you to jump up and dance in your spaces in the stretch breaks. So let's get to the program. The purpose of this forum today is to explore priority issues in emergency management for people with disability and look at why responses are failing to be consistently inclusive, in spite of the rights-based frameworks and policies that are in place. This year is a strong contender for the year of the disaster. We have seen the longest drought, highest floods, and most intense bushfires on record, and a global health pandemic that continues to wreak social and emotional and economic havoc. Time and time again, we find the needs of people with disability are overlooked, or at best, only considered in a piecemeal manner. For example, when COVID-19 hit, it took 70 national, state and territory disability organisations to sign an open letter calling on all government levels of government to consider urgent actions that will protect the lives of Australians with disability before public health officials scramble to engage. As the community concurrently navigates bushfire recovery and COVID-19 response, we have a unique opportunity to come together to centre the lived experience of people with disability and reflect on, learn from and advocate for improved responses to people with disability in times of disaster. We could spend a lot of time unpacking the reasons for institutional neglect, but what we really want to know is, in the context of emergency preparedness, response and recovery, what has to change to ensure the rights of people with disability are embedded in a meaningful way into all government programs, plans, strategies and policies? How do we clear our path to full inclusion? I would first like to hand over and hear from Victoria's Emergency Management Commissioner, Andrew Crisp, who will speak to the importance of the discussion today.
Hi, Andrew Crisp, Emergency Management Commissioner. Thanks very much for the opportunity to join you today for the start of this really important workshop. And there's never been a more important time for us to talk about disasters, about emergencies, about resilience, but particularly in terms of the impact it has on people with a disability. And we've all been tested in so many different ways over the last few months when it's come to COVID. And I know that has also been the case in relation to people with a disability. I know that there is more that we can do, and that's why a workshop like this is really important for me to listen to the outcomes, and I look forward to that opportunity and to have a follow-up conversation with you. And I must admit, it really hit home to me when I went to California last year, when I was part of an Australian delegation that was looking at recovery from catastrophic events. And as part of that trip, we went to California and met with the California Office of Emergency Services, and again had a great presentation from their executive lead in relation to disability. And it was a person in a wheelchair. And this person gave such insights in relation to his experience working in that particular role. And he was quite engaging and told a really good story, and he told a number of stories to make that point. And I remember one where he went out to a fireground or where a relief centre had been established. And he could get into this particular facility, but then he couldn't use the bathroom because he was in a wheelchair. It wasn't set up for him to use. It was such a simple story, but it was also a really strong story and a reminder for me about things that I take for granted, I know that I need to do more about. So again, can I thank you for coming together, particularly during COVID, and it is important that we continue to engage and to learn, and I really do look forward to learning the outcomes of your discussions here today. Thank you.
Thank you, Commissioner. This forum is certainly not going to be the type of forum where we all talk about the problem, then pack up, turn off the computer and forget about it. We will package up all that we have learned and take from today and put this in an issues paper that the sector will use to advocate for real and practical changes. So let's get to work. What are we working within? Key national frameworks such as the National Disaster Risk Reduction Framework 2018 and the Australian Disaster Preparedness Framework 2018 have been truly tested. People with disabilities require governments and other partners in emergency preparedness, response and recovery to do better. And what about the NDIA? How effective has it been as the go-to agency for people with disabilities in crisis? How have those people who have faced extra disadvantages fared, such as people with complex communication needs, live remotely, or are illiterate? Professor Anne Kavanagh measures the protections outlined in the policy framework against the experience of people with disabilities, particularly during COVID-19, and provides pointers to where the shortfalls might lie. Please welcome Professor Anne Kavanagh.
Hello. Can you hear me? Can you hear me? Can you hear me? Hello?
Yeah, we've got you.
Oh,
We can
sorry.
hear you.
Okay, are my slides up then? Oh, okay, thank you. First of all, I thank you for that introduction, Melissa, and I just wanted to acknowledge the traditional owners of the land on which I'm currently residing, the Wadawurrung people, and I acknowledge their owners past and present, and any Aboriginal people in the audience today. So I just introduced myself as my background. I trained in medicine originally and then in public health as an epidemiologist, and now I never have to explain to anyone ever again what an epidemiologist does or is, which is pretty cool because before everyone thought I studied skin. But having said that, I'm not an infectious disease epidemiologist, which is those that you've been hearing from a lot in the media. So I just thought I'd start just by outlining some of the basic principles. I know you all have heard them kind of ad infinitum over the last last 6 months, but I thought I'd just remind us, because I think then we can understand how the response for people with disabilities has or has not been ideal in terms of how we've responded from a public health perspective. So I'm just going to start by talking about COVID, which we all know arose in late December, the first case in Wuhan in China, and we had our first case in late January from a return traveller. So COVID, actual name of the virus is SARS-CoV-2, severe acute respiratory syndrome, and it's caused by a coronavirus, which is a virus which is like the common cold virus, which is a common cold virus, but this particular strain is particularly infectious and has high case fatality. The actual, which means more people die from it than obviously from the common cold. The condition that you get, COVID-19 is actually the disease rather than the virus. And the main way in which it's transmitted is through droplets. And we've heard a lot about aerosols and droplets and different types of transmission. And really, when we're talking about droplets, we're talking about two types of droplets. One, the respiratory droplets that are kind of bigger, and we were early on thinking that was the main way of transmission, 5 to 10 micrometers, which are transmitted through direct contact or indirect contact with surfaces, and tend to, be about within 1 metre in terms of direct contact, whereas aerosols are a bit smaller and last in the environment for a longer period of time and can travel much more than 5 micrometres. So early on, we thought that the main source of transmission was through the direct contacts, the larger droplets. But as time's gone on, there has been more evidence to suggest there also is aerosol transmission. The main ways in which public health response looks for COVID-19 is we're going back, it's a pretty basic response, really. It's about reducing people's contacts, minimising contacts with other people to reduce infection. So we're really talking about physical distancing, hence that we keep apart and we don't mix. So we're less likely to get it transmitted between us. And we reduce transmission and exposure through the travel and border closures or closures of things like schools, gyms, workplaces. We have, as we've all learnt, strict infection control and personal hygiene practices from, as you've all probably got, frequent hand washing or sanitisers. And really what we're looking for is a very strong cooperation from everyone in the community to take part in trying to reduce risk of transmission. So this isn't an individual, this is a collective response. We're about protecting each other as well as ourselves in a pandemic public health response. So that's really what underpins a public health response. And now I'm going to talk specifically about some of the issues for people with disabilities. And obviously we've talked about these a lot, and a lot of these were brought up in the Commission last week for those of you who heard a lot of that. But the first thing that comes to mind is that many people with disabilities are reliant on external supports, perhaps to provide personal care and so forth, which requires close contact. And so the capacity to physically distance is more difficult. And they may, in fact, be having multiple people helping to provide their care, increasing again their networks and risks of transmission. There's also the risk of sometimes either living, recreating or working in a group setting, a workplace, a home, or potentially a day program. And all of those increase the risk of the number of people and the close contacts. And of course, in terms of us preventing our own risks, we need to understand the public health information. And very early on, as we'll speak of, there was not much effort really put into making that public health information accessible. And then there are additional issues for First Nations people with disability and culturally and linguistically diverse communities. We also have higher levels of what people sometimes refer to as comorbidities, diabetes, respiratory conditions and so forth that put us at greater risk if we become infected. And as we've talked about a lot previously, the health sector tends to have a poor understanding of our health and the skills needed to respond, and including underlying biases and discrimination, which I won't go into today, but clearly put all of us at risk, whether or not we have a underlying condition. So I've just put a bit of a timeline here because I think it helps us just remember, I think this is a story. I'm telling it a bit as a narrative, and I think it tells the power of advocacy, the power of advocates working together, the power of advocates working with academics, the power of the sector working together to start to mobilise a response here. So I just want to highlight a couple of things on this slide. The first is on the 17th of February, the Australian Health Sector Emergency Response Plan for COVID, which clearly did not include people with disabilities. And so that was an oversight, or not an oversight, but we can talk about what that was. Sorry, gone on slide that I didn't mean to. And I'm going to talk a little bit about our role as academics in trying to help mobilise a disability response in COVID. So I'm a co-director of the Centre for Research Excellence in Disability and Health with Gwyneth Llewellyn from University of Sydney. And as public health academics and disability researchers, we thought we were in an ideal position to start to influence how government thought about their response to people with disabilities. So on the 16th of March, we released a statement, which I'll come back to. There's a range of other things that happened. There was a joint disability sector union response and a further response that we made. I just want to highlight a couple of things there on in relation to the NDIS on the 21st of March, outlining things like the potential for telephone planning, extensions to plans, trying to come together with an action plan to ensure ongoing essential supports, shifting capacity building to core, and in my experience that hasn't been possible. I'd be interested to know whether other people have found that possible. Proactive outreach to what they referred as vulnerable participants, and a 10% loading for services, which I think, and I'll come back to in relation to what kinds of perverse incentives that might bring for services. So then just to go into a bit more detail about what we said, I need to be conscious of time, but our original statement was to call on all parts of government, and I think this is critical. We need a Commonwealth and its Commonwealth agencies, the NDIA, the National Quality and Safeguard Commission, the Department of Health, the Department of Social Services, and then we have in the states, health, various disability sections of the department, of government departments, and potentially regulators within each state of services. So this is a complex response. We acknowledged that there was a real problem in the health sector's underpreparedness. We emphasised the need to accessible testing, telehealth, a potential dedicated hotline, and accessible information, and real thought in how we continue to support people with more complex needs in the context of if they need to quarantine or self-isolate. And we called for this at all levels of government. There were some responses, but we remain concerned on the 24th of March, and in particular in this statement, we argued for the need of a national committee that reported to National Cabinet, As you know, that was established in terms of emergency response in March, but that there needed to be a plan to think about how we're going to protect the health and well-being of people with disabilities during the pandemic and beyond. And one of the things that as public health researchers we were very concerned about was the lack of an integrated public health disability response. And I think this is probably my enduring criticism of the way we've gone about this. I think there's huge improvements, but there's a long way to go. At that stage, we were concerned again about accessible testing. We wanted upscaled access to telehealth. We thought that the NDIA and National Quality and Safeguards Commission needed to concentrate more on a public health response, and that the NDIA's response at that time was very much on processes, and that there were some opportunities through their reach out to reach people with disabilities who might need more information, might need more supports, might need some assistance with a range of things beyond a disability response. We asked for the MBS item on vulnerable populations, which is a special MBS item to develop healthcare plans to include people with disabilities as a vulnerable group. Now, I'm not going to talk, I know that's not something that's contested, but it's actually in the MBS item, and so it include people with various other groups, Aboriginal, Torres Strait Islanders and so forth. So we saw that as an important item, which did happen. We talked about disability services needing to be an essential service. We asked for reach out to self-managed clients who might not get information through their services. We also asked for things like the information hotline, pandemic leave for support workers so they don't go to work when sick, some local coordination and compensation, and for the direct outreach to services to make sure they were abiding by the public health directives of that state. And it's fair to say the National Quality and Safeguard Commission at that point had released provider alerts and so forth, but we were really, really trying to push the need to outreach directly to services rather than have them self-regulate, if you like, and I'll come back to that point, and wait until an incident happened, but rather be much more proactive in terms of enabling a public health response. And as I've said before, this is a once in 100-year event, and none of us were prepared. Disability services are not health services, and so they were perhaps less prepared than our hospitals and so forth. But we've seen the problems even in those settings. We thought the need for important local coordination at that point. There's two responses here that are important to talk about, and that was the health sector union, the union's response with NDS, which again talked about some of the things that we did, including pandemic leave. And it's notable that that still is not available throughout Australia. It's only in Victoria at the moment, I understand. But issues, again, around potential payment of family and carers if they decide to support the person to reduce, with a disability, to reduce social contact and potentially compensate them for having to not be able to work themselves. I think then in April we saw the advisory committee established, on which I'm part of that committee, and a number of DPOs, academics, clinicians and service providers to come up with a response to how we might manage the response in the disability context. So I'm just going to take a drink. A number of other things happened, and I'll come back to the open letter to Cabinet from the state and disability organisations, and I'll come back to a couple of other things there. But we had ongoing announcements from the NDIS around continuity of supports. We also had the 10%, various other promises in terms of extension of plans and an ongoing commitment to reaching out to participants who they defined as vulnerable. Sorry, I've just highlighting the sector response, the advocacy response, which is the slide on the right-hand side of the slide, the media release there, which was 70 organisations, and in fact we signed on to that as a CRE, and they that again emphasised some of the issues around healthcare access. Importantly, the need to fund DPOs, particularly in these contexts where there was much more need for advocacy, both individual and systemic, and again, emphasising continuity of service and the definition of disability services as essential services. Sorry. So, as I said, that was the first meeting of the advisory group on the 2nd of April, and finally the plan was endorsed by National Cabinet, the Australian Healthcare Protection Principal Committee, and then National Cabinet. And this plan was based on a human rights approach, had a section on preparedness and targeted action in relation to disability, and also stand down and evaluation. You can read that all yourself rather than me go into big detail. Rather, what I will do as we go on is describe what happened and what didn't get taken up and the lessons learnt. So one of the things that I remained very concerned about post this plan was issues around congregate settings, be they residential settings, day services, and supported employment. And one of the concerns I had was services were obliged to comply with the public health directives, yet the decision on whether they could do that was left up to the services themselves. And as I said, services don't necessarily have the requisite public health skills to be able to do that, and marry that with their capacity to, if they lose, with the problems of them being given a financial perverse incentive, if you like, to stay open, given that 10% loading, which I might say was passed on to participants rather than additional funding in the plans. And I was particularly concerned, we can't close where people live, obviously, but we can think about ways in which, whether day programs, for instance, or supported employment, where a lot of people are congregating, should stay open, particularly when there are high levels of community transmission, and where that should be a directive rather than something left to the individual providers to make that decision about. And I remain concerned about that. I remain concerned that there's a lack of direction of around those activities, particularly thinking around that in areas where there's increased community transmission. I recognise this is a difficult problem, and we need to think innovatively about how we could provide alternative supports in those settings. So fast forward to June, a lot happened in May. It's not that things didn't happen in May, but things changed in June, July, August, as you know. I just want to emphasise some of the issues. I'll come back to our paper in early June, but lots happened in July and lots happened here in Melbourne and Victoria, which meant that we no longer had a universal response, and we really needed to think about a much more tailored response, both for people with disabilities and the rest of the population. And obviously we saw the shutdown of the Flemington and Northern Melbourne public housing estates going into lockdown, and that, I guess, made us even more concerned about what was happening for people with disabilities, and prompted us to put another statement in for a much more localised response. We can see that there was recommendations for the first time around face masks. There was some change in funding from PPE. I think some of our concerns around that was, again, it had to come out of people's plans, and it's great now to know that that's been changed and it's not having to come out of individuals' plans, both from the individual perspective of not having enough, but also the very complicated way of getting access to PPE if you have to rely on drawing down on individuals' plans. And I'll come to our statement on the personalisation. Now, we're all very much committed to the NDIS working, but there are some issues that arise when you're thinking about a public health response and how you're thinking about a structural policy response versus an individualised response. And I think some of the things that have arisen there, which is not unique to disability services, but is the increasing nature of disability service provision in a so-called gig economy with lack of worker protections and the paid pandemic leave issues. And I'll come to our survey, but there were issues and worries around support workers taking sick leave and losing pay, quite understandably for a low-paid workforce. And it also, as I said, in relation to PPE, meant that there was a very complicated way in distributing that PPE through individuals rather than getting it out to services, no cost to individuals, no need to change their plans, which is very awkward in those contexts, you know, people suddenly having to draw down on quite expensive PPE, particularly if someone becomes infected. And what we need is very easy access to PPE as needed rather than complicated ways of having to access it. So there are some issues there that arise, and also the issues arising around needing to, for the NDIA, rapidly look at individual plans rather than think about a more systemic way of responding to potential funding shortfalls for individuals. So that was one comment, one paper that we published on that in Disability and Society. And then, of course, as I said, we became very worried in the relation to the lockdowns, and we were very much thinking, well, a lot of people, we'd always said this, if you think through the NDIA as being the key agency, you miss a whole bunch of people with disabilities who also might need support either through other schemes or don't have or aren't necessarily getting NDIS packages, or they don't qualify because they're not an Australian resident, for instance. So we were saying, look, we were particularly concerned with people living in the housing flats and the lack of a coordinated response for people with disabilities in that context. We didn't know who had a disability, and that became very clear. How do you reach out to people if we don't know who they are? So we were suggesting a very grassroots reach out to people within the Housing Commission flats and in other at-risk settings to assess immediate needs, whether they are continuing to access services, things like did they have access to internet, did they know and understand what the personal hygiene and other practices were. I'm particularly concerned that it's very well to have things like, I probably haven't emphasised this enough accessible information, which didn't come till late, but that it's very important that that gets to people, and sometimes sitting on a website is not the way to do that. So much more active outreach, thinking about issues around proactive healthcare planning for individuals, which I've been pushing all along, and accessible testing. We still didn't have accessible testing at that stage. And also thinking about the risks of people in lockdown in terms of violence and abuse, but also people in congregate settings. Again, emphasising the need to outreach to services, revision of PPE guidelines, and audit of services. And we did make some comments around children and young people and employment and school return, but I'll leave that for now because I'm concentrating on public health. Of course, some of you may have heard, I need to hurry on, I guess, about our disability support worker survey, which has had a fair bit of media press. And I just want to emphasise a few things. So this was done mainly in June. It's notable that nearly 60% worked in group homes. Many worked across a number of different group homes. It's important to recognise that 23% had not received any infection control training, never mind PPE training, and still those that had, the vast majority, half of them wanted more training. Most of that had been online. One of my concerns with PPE is once you move to full PPE, you have very high risk of cross-transmission, and you need very clear guidance on how to do that. I think with the, I'll come to health worker infections in a second and the worries about that. We're also very concerned about this workforce more generally and the financial consequences for them in this pandemic and psychological consequences. Again, many referred to their difficulties being recognised in the essential workforce and access to testing. We started seeing outbreaks in residential services. I think there's at least 60 disability residential services where we've seen outbreaks. And we did see some announcements from the NDIA for 4 large experienced disability providers. I guess one of our major recommendations from the workforce survey was we needed to think about restrictions on worker movement like we'd seen in aged care. We needed much more active engagement in creating a standby health risk care workforce response to work alongside disability workers, a surge disability workforce, and we needed to think of alternative places for rehousing if some residents were infected and others weren't. One of our major problems, I guess, was that we weren't getting the figures on disability infections. So it's notable, this is the release from Minister Robert on the 21st of August, which provides some information on both cumulative, that's cases over the whole time period, versus active cases. And as you can see, at that point, there were 106 infections, 70 in workers and 36 in participants. But we know that obviously cumulatively there's been over 164 worker infections and 93 participant infections. Obviously there's more. That was the 21st of August. We saw this release, interestingly, on the last day of the Royal Commission's hearings, finally, to set up a disability response centre centrally with the Victorian and Commonwealth governments. I'll just skip back to this slide. I would like to say the devil's in the detail, the footnotes. So this one requires services to report cases. And we know that particularly for workers, that's likely to be an underreport. It also doesn't include self-managed participants potentially, doesn't include people with disabilities living in aged care services, in residential aged care, because they're not required to, the National Quality and Safeguard Commission doesn't regulate them, and it doesn't include people in the so-called transfer sites in Victoria, the group homes that are still regulated by the state government and still funded by the state government in kind, which is about 45% of disability residential services in Victoria. As I said, this was a welcome announcement, and the devil's going to be in the detail regarding this, particularly in relation to how we create a surge workforce. This was released yesterday, and I just want to draw your attention to the bottom half. I haven't emphasised that early on in the pandemic, we might not have expected a huge number of infections around people with disabilities or workers, because it was predominantly dominated by overseas return travellers. Now, with high rates of community transmission, unfortunately, we are seeing some transmission. Asian disability care workers are included together in this report. The take-home message from this is that 73% in this second wave were acquired in the work setting, but there's still 16% to be allocated. So if you assume the same in that group, it's about 90% of workers being infected in the workplace. Something is happening that's really troublesome. So some good things, we started to see national and state plans. We saw some healthcare initiatives. We had the coronavirus hotline set up, and that's been incredibly important. Finally, in Victoria, we've had paid pandemic leave for support workers. Accessible information has started to become available. Some more flexibility in our NDIS support. There's worker training modules, but I just don't think they go far enough in terms of a much more outreach in terms of worker training, particularly in relation to PPE, when evidence is suggesting quite a lot of that transmission is happening between workers, donning and doffing PPE, being together in staff rooms and so forth. Outreach to services in Victoria has started to happen, but that's been great to see. But in some ways, I would recommend every other state think about that, because it's a little bit late now, and it's not too late, but we need to be doing it proactively. Risks going forward, no disability-specific outbreak management plan. We are included in one word in the aged care outbreak management plan, but it's becoming increasingly focused on aged care and isn't really relevant. Lack of reliable data. The challenges on the roles and responsibilities of the various Commonwealth and state and territory agencies, I think that's still getting in the way of the systemic response. It's improved, but it's not perfect. And I think, as the chair of the Royal Commission said, the virus doesn't really care what jurisdiction is responsible or what portfolio. Again, auditing of services, community outreach, still don't have a surge workforce, and training, as I said before. So that's the end of my presentation, and thank you for listening.
Thank you very much, Anne. That was really, really insightful, and it just brought home to me how much has happened over the year and how reactive we have been as a country to the issues of people with disabilities, and it's just simply not good enough. We need to be more proactive in making sure that we have a better plan going forward. So we only have time for one question today, so the question's going to come up now. So in seeking out those with a disability in the towers, how did you work with local government?
I'd have to say we didn't work with local government at that point. I think there are a lot of people on the ground working with local government. I think that's incredibly important to work with local government. But we didn't personally work with local government, although we were lobbying very hard through government of the role of local government. That's my answer.
It seems like that maybe some of the local solutions can be some of the better solutions.
Yeah, exactly. I mean, one of the ways we've now moved is suggest that we need a community-led response, and I didn't get a chance to talk to that, but I think Michelle will talk about that in relation to bushfires. And that's where the role of DPOs and various other community organisations are really important.
Yeah. Well, thank you very much, Anne. Thank you for taking the time out of your very busy schedule to speak with us today. It was really, really appreciated.
Thank you.
Now, everybody, we're going to a 3-minute stretch break. So crank up the volume, have a little dance in your spaces, and we'll see you back shortly.
This storm is coming like a ghost town. All the clubs are being closed down. This place is coming like a ghost town. Bands won't play no more. Too much fighting on the dance floor. Welcome back, everyone. I hope you all feel a bit more energized and you're back in your comfortable positions. Emergency management is complicated and it's usually divided into planning, response, and recovery. The planning phase is crucial in order to identify the risks and who is more vulnerable to those risks and develop a plan of action for when disaster strikes to stay safe. Whole conferences have dedicated themselves to thinking about these things. But might it be the local solutions that are inclusive of people with disabilities are what really works?
Michelle Villeneuve led the Disability Inclusive Disaster Preparedness in New South Wales project. She will provide key findings and steps to making a disaster management plan that is truly inclusive of people with disability. Please welcome Michelle Villeneuve.
Thank you very much for that introduction, Melissa, and thank you for having me today. I really appreciate it. I'd like to, oh, sorry, I've just lost my video there for a second. I'd like to recognize that I'm actually calling in to you from the land of the Gadigal people of the Eora Nation. I'd like to pay my respects to Aboriginal people and elders, past, present, and future emerging leaders as well. Today, I actually have chosen to speak very specifically about person-centered emergency preparedness and a peer leadership program that we've been engaging in Queensland, actually. On the slide, what you'll see are two of our peer leaders from that project, and they're actually role-playing at the front of a classroom.
It looks like we have frozen for a bit. We'll just give Michelle a few minutes. COVID-19 has taught us one thing, how to navigate all the technology glitches.
To the call, something happened there. Can you hear me?
Yep, we've got you.
Okay, excellent. Thanks very much. So I'll start again because I'm not sure how much of that you heard. I'm going to talk today about person-centered emergency preparedness, and I'm going to specifically focus on a peer leadership program in Queensland. Before I do so, I really want to put this program of research into a context for everyone. We've been conducting research in partnership with communities for a number of years now. And on the slide, you'll see a timeline on the left, which actually shows visually the trajectory of our research from 2013, when we started this work in Indonesia, all the way through the number of projects that we've been engaged in. I think there's about 9 projects on the screen, and that's just a flavor of the work that we've been doing in this space. On the right hand of the slide, you see pictures of people with disability, emergency managers, community service, healthcare providers, talking together about what it means to be inclusive of people with disability. That's what DIDRR is all about. It's about making sure the voices, the perspectives, and the needs of people with disability are considered. But it's not only about making sure that they're considered. It's about making sure they're responded to and acted upon. And so this program of research is actually about connecting the different sectors that have a responsibility in keeping people safe, together with developing capacity for us as individuals and the service providers who we work with to support and help to keep each other safe. And so I wanted to just say that this snapshot of the work we're doing in Queensland is just one illustration of the way that we've been working. And I hope that that will maybe inspire innovation in the different communities in which you work, and increase perhaps some motivation to knock on the door of someone from another sector, maybe you haven't reached out or worked with them before, to be able to engage in conversations about disaster risk reduction. The slide here just shows the scope and the scale of the partners with which we work. And I want to reinforce that the exciting thing behind the research that we do is that It doesn't sit at the university. It takes place in the community, and it takes place with people. So I hope you'll see through the project I explained today how that actually works. The other thing I wanted to show you before we got started was this framework that we've built. In Queensland, we started the Queen Project focusing in on bringing people with disability and their representatives together with community disability healthcare providers and local disaster managers. So we're talking about the people at council, local councils who develop emergency and disaster management plans and engage with communities to keep their community safe. And we're also talking about emergency service agencies who are on the ground and in the field keeping us safe, particularly when there's an emergency of some kind. And they have an important role in sharing information and making preparedness resources available, but also reminding us what our different risks are. The other thing I wanted to say about this framework is it takes an all hazards approach. So when we talk about inclusion in disaster risk reduction, we're talking about all hazards. So Anne earlier today talked about the pandemic. Obviously, we understand now that that is probably the single most emergency that we're all at great risk for. But there's other emergencies we're hugely at risk for. House fire, for example, is something we all need to consider. And of course, the last summer has really helped fuel our understanding, no pun intended, of the critical impact that bushfire emergencies can have. Floods, cyclones, East Coast lows, and other challenges to our everyday living can come about because of natural hazards that can provoke an emergency. So the framework we built through that community engagement was to look at what are the roles of the individual stakeholder groups in this process, and how do we come together to share what we each know and do and bring that together to more effective, inclusive disaster risk reduction practices. This framework and the whole toolkit is available on our website, and I'll show you later where you can find that information. What I really want to zero in on today is the role that people with disability can have and how that might work. And the framework identified short-term, medium-term, and long-term outcomes. In the short term, we're looking to increase the capacity of people with disability to self-assess. What's my risk for natural hazards? How prepared am I right now? What are my strengths and what are my support needs? And then use that self-assessment to make a formal emergency preparedness plan that's tailored very specifically, not only to my support needs, but the resources and the people who are likely to be near me when a disaster strikes. And that's usually family, friends, neighbors. And it's not often the emergency services who are the first responders when that initial emergency strikes. So we really need to think about who is in our network. The ultimate long-term goal is that by engaging in this process and making a plan, that people with disability realize their self-reliance and also their planned reliance on others. But going back to that framework I just showed you for a minute, this doesn't sit by itself. This is one part of the larger puzzle and the larger responsibility that we all have to share in this process. Now, we used a couple of tools. The Person-Centered Emergency Preparedness Tool, which you may be becoming familiar with, I hope you are, which breaks emergency preparedness down for people with disability into these 8 domains or 8 elements. Things like social connectedness, how I manage my health. Do I have assistive technology? And how do I manage assistive technology? My personal support and how and where I get support from, assistance animals, how I communicate, and my living situation. So the capability wheel is what we actually call this, and we call it the capability wheel because these are things we all need to consider when we're taking care of our safety. And there are additional things that people with disability need to consider and pre-plan for. We call them capabilities because it's a combination of my strengths, my resources, and my support needs. And we need to put that piece of the puzzle together and make our plans fit to our specific and unique needs. Now, person-centered emergency preparedness happens as a process. Emergency preparedness for all of us really needs to be a process. We can't do it all in one go. And the person-centered tools that we've developed really focus on it being a conversation in 4 parts: identifying those strengths and support needs, learning about your local hazard risk and connecting in with your local emergency managers to understand the steps you can take in your community. Planning very specifically how you're going to manage that given your own unique support needs, and communicating the plan with people in your support network. And that is really important because it means there's gaps, lots of people in emergency preparedness, and for people with disability, there may be some significant gaps that may require support. Ultimately, the goal of using person is to prioritize planning based on those functional support needs, optimize self-reliance, and plan for what you need others for in emergencies, address any gaps in your plan through collaboration. Now, we also use an existing peer support program as part of this project. The Queenslanders with Disability Network operate a peer leadership program. They provide support to communities across Queensland. And on the map, you will see a group of people with disabilities having a conversation about preparedness. And on the right, you'll see a map and the pinpoint the 25 peer leaders from the Queenslanders with Disability Network who provide peer support across Queensland in the community. And they normally do this through peer support and sometimes through individual support and mentoring in the community. Now, we wanted to combine person-centered emergency preparedness and this peer support program, this model and this very effective program that's already happening in Queensland. And we needed to find a way to knit these two things together and introduce a new skill to the peer leaders in the program. So what we did was we considered transformational leadership as a way to identify what we really want to see these peer leaders doing. We wanted them to act as role models for emergency preparedness and personal planning. We wanted them to have and hold high expectations and inspire optimism about what is possible for people with disability in making their own plan and navigating some of the challenges and the barriers through collaboration in the community. And we needed to make sure people had an acute understanding. We wanted them to have an acute understanding of individual needs. So we didn't want them to just share resources and say, here you go. We wanted them to go a step further and begin to think about what are the support needs of the people in my peer group, of the people that I support, and have and expand on conversations so that they could share information in more effective ways and provide that natural social and emotional support to each other. We also wanted people with disability to use the skill we know they have tenfold, and that is their skills as advocates. And that was really important with the Queenslanders with Disability peer support program, because these peers, these 25 peers we were working with, had already developed incredible capacity as advocates for disability rights in their community. What we now wanted to do was add on emergency preparedness and think about what do those rights mean in the context of emergency preparedness planning, responding during a disaster, and recovering in the long term. And so that's what's created the person-centered emergency preparedness peer leadership program. On this slide, I won't go in great detail, but I wanted to really relay the point that how we work is cyclical and iterative. We work through a number of actions to co-design products and tools. We try them out and we test them. We monitor and evaluate how it's going. We sometimes change things up in the process if they're not working. And if something's going really well, we try to find ways to amplify that. And so that's what this diagram is trying to show. And I'll just tell you a few examples of how that looks in practice. So in practice on this slide, you'll see a number of people. These are our peer leaders, and this is at the first training. And you'll notice that at the front or sitting in the seats are people holding the microphone. Who's holding the microphone? It's our peers with disability. And that's because the training itself was co-designed and it was co-led and delivered by this peer group. So that took a little bit of planning and a little bit of initiative on our part, and bringing together not only people with disability with the lived experience of disability, but also finding and resourcing people with disability who were also experts in emergency preparedness, and beginning to share information together about how they can operate with their peer groups in the community. The other thing we strategically do in the work we undertake is we make sure we connect people with disability into the local emergency managers. So an example was at this workshop where we were training the peer leaders in person-centered emergency preparedness. We made sure we brought state-level emergency managers and local councils who do disaster resilience work at the local level of the community to share what they know about local hazard risk, and also to connect them into the resources that these peer leaders will need when they go back to their communities and need to connect back in with their local emergency managers and look on the right websites for the right state level information and resources, and connect in with the Get Ready tools and programs that are available to them in the community. This is really important. People with disabilities, as Melissa has talked about already today, have been excluded entirely from the disaster management process. And so part of our method and our madness is to make sure we're bringing emergency managers together with people with disability in dialogue. The dialogue where the rich learning happens, and we're seeing responsiveness on both sides. People with disabilities learn about what is needed to make a plan, what can be realistic, and what is maybe unrealistic and they need to have contingencies for. And at the same time, emergency managers are learning a heck of a lot more about how to make their resources accessible, what people with disabilities can do, and what they need support for through the process. I'd like to just show you a little video to give you a flavor of what that's like from the perspective of one of our peer leaders.
I'm Nadia. I've been a convener for about a year. Before that, I was coming along to the group for about 2 years. So I've become a lot more confident as I've come along. And now I'm able to help as co-convener, which has been a really exciting opportunity for me. When we were asked if we wanted to participate in person-centered emergency preparedness, I thought, that sounds really heavy, but I'll give it a go. And I've come in here today and had the opposite experience. I'm very excited because I see so much strength in my group, and I think each person in my group has very different needs, but also very different strengths. What are some of the things that you might not even be aware of, but areas in which you're already ready for a disaster? What are some of the skills that you already have? Where are you starting at? And what are some ways in which we as a peer support group can help to build you up?
So that is an example both of what our peers are learning as a result of engaging in person-centered emergency preparedness and taking that out to their peer groups. But it's also an example of our products in progress. So what you just saw is a draft clip of what we're building together with our peer leaders that at the end of this project, we hope will show not only their own preparedness planning process that they've gone through, but also the roles that they've taken on as peer leaders in their communities and how that's had an impact with their peers. So I was really pleased to be able to show you a small glimpse of that video, but at the same time, I recognize in seeing a very tiny edit, you're not seeing closed captions or Auslan interpreted, thanks to our Auslan interpreter here today that helped to rush through that. But those final products will have all of those accessibility features once we finish them. Now, Nadia shared with us on that video that the process is overwhelming, messy, and confronting. And that's a message we hear over and over and over again from people with disability when they start engaging in person-centered emergency preparedness. And I don't want to undermine that that is a fact. For many people with disabilities, and the more complex support needs you have, the more overwhelming that process can be. But it's really important to also share the message from our peer leaders that it can be done and it really must be undertaken. And so that speaks quite a lot to transformational leadership, where we need to champion and have role models and give some worked out examples of how that actually looks in practice. We've learned through the process how important it is for people to have a healthy dose of realistic optimism. We are not going to have the perfect plan tomorrow for everyone with disability in all of Australia to manage every disaster. That would not be realistic. But we can start to self-assess where we're at today. I haven't thought about it. or I've thought about it, but I haven't really taken any actions, honestly. Or I've started to get organized and I've thought about my documents and really important photos and important papers, but I really haven't taken concrete actions I need to take, particularly those that are disability specific. And this is where the training becomes really important. And I suppose differentiates some of the training that might happen in the general community. Most training and capacity development and community engagement around disaster risk reduction is generalized to everybody in the population. This training and this toolkit is specific to the support needs of people with disability. And so when we're looking at progressing people along this continuum, we would like to see that their plans are disability specific, as our peer leaders would say, unique to their support needs, and communicated with their support network. It is really important for our peers and the people they support to understand that it can work. And those of you who were following the Disability Royal Commission last week would have seen Rikki Buchanan speak about how her plan worked. And I'm also have been a part of that preparedness planning process and some of the conversations that went into supporting Rikki to move along that trajectory of her own preparedness planning. And the other thing about our project was that COVID-19 put our training absolutely to the test. And one of our co-educators said, I know that COVID's going to be a game changer, but it's the ultimate test of our shelter-in-place plans. And we need to really use opportunity. So we actually, as part of this messy process of co-designing tools, took time out in March to adopt the All Hazards Toolkit planning and develop a COVID-specific planning guide. And we jumped forward with them sharing that throughout their peer support groups and tailoring that plan. That's all available throughout all of Australia. The guide is available on the website. And again, I'll show you on the last slide a link that will take you to all the resources that you can use and download. The last messages I suppose I want to leave you with is that there's lots of other facilitators in this process. And throughout our learnings, we're honing in on what are the critical key features and the ingredients of a support leadership program. How do we pack them into that program and produce resources that other people can use, and programs, ideally peer leadership programs that we hope will pop up across Australia by other disability organizations who already have peer leadership programs and are perhaps ready to embrace person-centered emergency preparedness as part of that trajectory of their peer support plans. We know that the plans need to be, and the process needs to be strengths-based and capability-focused. And what our peer leaders have benefited from most is the stories, the sharing together, the working out some of the challenges that each of them experience, but perhaps in slightly different ways, and having the worked out understanding of, that's what worked for Tony. I could probably try it if I do these things. And that kind of support is really what motivates and propels people along that to more prepared. The other thing that's really important is having results that break it down. So the person-centered framework that I showed you at the beginning that breaks it down into 8 elements is one thing. Another thing is the workbook that we've just produced with these peer leaders, also available on our website, which breaks it down in 4 conversations. And we've been intentional by saying this is not necessarily a written document you fill out, although there's lots of room for written self-reflect in the workbook, but it's primarily and fundamentally a conversation guide. And we advocate that people have emergency preparedness conversations in conversation with other people. And I guess the last thing I wanted to say is how critical it is for people with disabilities to have a leadership role in the space, and the critical importance that's been, I know from our research team's perspective, in having champions on the ground who really truly understand the lived experience of disability and can really get behind emergency preparedness and adding that to their repertoire from an advocacy perspective and sharing that throughout the community. The exciting part when we think about between what they're doing and the other areas or stakeholders involved in this process is that we're getting that dialogue. We're getting that dialogue with local councils. We're getting fireworks happening among service providers saying, we could share these resources through the disability support organization I work for. And I think that's how we're going to begin to see preparedness grow and safety and resilience improve. I'm just sharing the website where you can go and download these resources and have a look at our other projects and look in a bit more detail at some of the other things we've been doing in New South Wales, where some of this work was initiated, and some of the things that are up and coming in programs and communities. And I do want to draw your attention to, on our person-centered project page, to resources we've recently developed for people from culturally and linguistically diverse communities. We've tried our best to all video-based resources and user-friendly books that help people instead of academic papers and thick resources that you need to wade through. So we hope you'll enjoy looking at those resources. And I just want to finally acknowledge the support from our funders. In the project I talked about today, it's currently funded by the Queensland Government through the Queensland Disaster Resilience Fund and the Department of Communities, Disability Services and Seniors. It's led by the University of Sydney and my team of researchers, but can only happen in partnership, which happens with the Queenslanders with Disability Network and the Community Services Industry Alliance. And I do want to acknowledge the work that went on before that. I was leading a project called Prepare in New South Wales, which produced these person-centered tools, and the Joint State and Commonwealth Natural Disaster Resilience Program funded them. A whole large cohort of multiple stakeholders from New South Wales have been a long part of this journey toward improving preparedness. And of course, I want to thank the Queenslanders with Disability leaders themselves and staff who are supporting the project right now. I'll leave it there.
Thank you very much, Michelle. That was really, really insightful, and it's very clear that this project has thought of all the things that people need to think about in terms of any type of disaster that comes across in their lives. It's really important to be prepared. Now, because we're running out of time, we have some questions, so I would like to jump straight into the question. Can I have the first question, please? Okay. Connecting up different stakeholders takes time, persistence, and energy. How do we get all the parts motivated? Experience of many people with disability is not to be listened to or have our needs considered. How do we get planners interested?
Mm-hmm. I think my gut response to this question, although if I reflect on it for the next 24 hours, I might have more ideas. But I think my gut reaction is, from a community development perspective, mobilize. And how do people with disability mobilize best? Through their disability organizations and the support that they receive. Because when we mobilize together as a group, our voice are amplified through an organization. And I think part of the reason I wanted to share the particular example of working with the Queenslanders with Disability Network is because they've got a particular skill, I think. They've got a skill at amplifying strategies, issues, and ideas upward toward policy decision-making and advocating on that level. But they also have a deep connection to their members and what their members' needs are across all of Queensland. And I think unique combination of those skills within a disability organization. Now, the next logical question might be the other issues surrounding that, continuing the funding and keeping those supports going for organizations. But I really think that it is that kind of persistence and that energy. And I do, the one thing I will add to that is the strength of our partnership. So our community organizations bring that nose to the ground, that everyday reality of living in their local communities and what needs to happen. And our academic team brings principles of evaluation and methodological approaches that help to systematically gather and share those resources and information and develop the tools. So I think it's a lovely marriage of the two skill sets where we can work together to make sure that we can make resources and actions available to everyone.
I suppose the disasters of 2020 have brought this to the forefront of everyone's mind now anyway, considering how unprepared we all were for this. Can I have the last question, please? Should disaster planning be included in NDIS plans? It's always going to be an NDIS question.
There's the $1 million question. Should it be included in an NDIS plan? Or should people have the flexibility in their NDIS plan if they need support to make a plan? I answer that question with caution, only because not everyone has an NDIS plan. Not everyone is eligible for the NDIS. Not everyone receives NDIS services. So I think yes, planning should be part of everyday planning because it's a part of our mainstream inclusion into all of society. And people with disability have the rights, just like any other citizen, to access mainstream emergency management information and resources and tailor them to their unique support needs. And that's essentially the role of support programs like the NDIS. But I answer it with caution because that would leave a lot of people out. And it really means that we need to think about this in the healthcare system, in the aged care system. We need to think about people who aren't on any of those programs. And so our approach to disaster planning in a multi-pronged way throughout communities is to make sure it's coming from every possible angle. And so I would suggest that one of the things that has been a really real strength of our partnerships, and we're beginning to see it flourish at this point, is our partnerships with local councils. And local councils have roles and incredible opportunities to connect in not only with those NDIS providers, but people working in homelessness and people who are dealing with other social issues that people are experiencing. And collectively, they can harness a lot of opportunity to communicate about these resources and get the messages out to their community. So yes, I agree. And I think it also needs to come in a multi-pronged way from a number of different sources.
Yeah, I agree with that. Thank you very much, Michelle. I really appreciate you taking your time out of your busy day to come and speak with us all today. It's really, really much appreciated. And thank you for all the work you have done.
It's an absolute pleasure. Thanks so much for having me. I appreciate it.
Thank you. Okay, everybody, we're about to head off to another stretch break that you can dance in your spaces again. And just a word that if you would like to ask questions, please put it in the Q&A box in Zoom, not in the chat box, so that I can make sure that your question is answered live. So enjoy your stretch break. See you in a few minutes.
Raise a glass to the end of it all. Who's to blame when it's everyone's fault? And we celebrate our way through dangerous times. Strange days are coming.
Hi everyone, so here we are back again for the last presentation before lunch. What are some of the things that are happening in the CFA? The Person-Centered Emergency Preparedness Framework is being used to inform the Preparing Vulnerable People project at the CFA. The resources that have been developed as a part of the project recognise that people with disability are in their best position to plan for their own safety in the event of a bushfire because they know what they are able to do for themselves and what assistance is needed before, during and after an emergency. Angela Cook will share the details of the project, the current resources available and the plan for trialling the approach over the coming bushfire season. Angela will introduce a person with lived experience, Tony, who will join for the presentation. So make sure you keep those questions coming in the Q&A section of Zoom. Please welcome Angela Cook.
Hi everyone. First up, I would like to acknowledge the traditional owners of the land, the Tanarong people where I live, and pay my respect to elders, past, present and future, and also pay my respect to Aboriginal science, culture and land management practices for which we still have so much to learn from. So it's great to be here today as part of the forum, sharing with you a project CFA is working on. We're working on that with other organisations and agencies as well. And of course, it's been great to hear from Michelle about the importance of a person-centred approach and an inclusive approach. I've been working at CFA headquarters in community engagement for the past 14 years. Actually, when I was younger, I wanted to be a human rights lawyer for Amnesty International, but the reality of studying law did not actually suit my strengths or my patience. And really, when it came down to it, I just wanted to help people and help people to help themselves. So CFA suits my values and desire to work with community in a positive way, to build community resilience and individual resilience, and to improve safety. So I'm currently the project manager for the Preparing Vulnerable People project. And today I thought I would share with you a story. And this story, it forms the foundations of the house, I suppose you could call it the house we are building with this current project. And at the time, back in 2018, I was working as the Senior Engagement Advisor for CFA, the Country Fire Authority, in charge of program inclusiveness. And the CFA Chief Officer asked me for some assistance with a response to a letter he had received. The letter received almost exactly 2 years ago in September 2018, and it was from Tony. Tony explained in the letter her circumstances. She has MS, multiple sclerosis, and needs assistance to move about. She described it to me in a later conversation as having a broken body or being broken. In the letter, she described her concerns about bushfire and wanted advice on preparation as she felt she could not leave. I contacted Tony to understand more about her situation. The conversation with Tony over the phone got the cogs turning in my head. How can we at CFA help people like Tony? And what does Tony need so she can help herself? At the time, I was on a working group with DHHS, reviewing the vulnerable persons in emergency policy. I had coordinated a submission from CFA about the policy as part of the review process. We were concerned at CFA about the register and what seemed to be a focus on evacuation for people on the register. We are concerned as fast-running grass fires and bushfires don't usually allow for evacuation. And this extended to other concerns about what if there were many people to evacuate? And what if these people needed specialised equipment or to be moved and transported? How is that going to work? And where was the focus on preparedness planning before an emergency, and in my case, before a bushfire emergency? And now I understand we're not alone in harbouring these concerns. Other Other individuals, agencies, and organisations have similar concerns. And at the same time, I also thought about and still think about CFA's message to leave early. Here's our advice. On the left is actually very small to see. That's a screenshot from one of our publications, which is titled Your Guide to Survival, one of our key bushfire safety publications. But I've highlighted a little red box. So basically, CFA advises that the safest option is to leave early on a code red, extreme and severe day. We also state that if you care for children, are older or have a disability, you must leave early. Sounds simple enough. But what if you can't leave? What if you need a lot of support and equipment to leave? What if you can't access transport to leave? What if leaving your house on an extremely hot day could cause more of a risk to your health due to the heat? And what if all of this is really scary and frightening for you? I spoke to Tony again, and CFA organised a free property assessment in November 2018. This was to provide advice about reducing the risk of a bushfire impacting on the house and provide ideas for improving preparations. I think I recall things like moving the hay bales away from the house and removing shrubs close to windows. This is a free service that CFA provides, and it becomes even more important if the resident feels that they may be unable to leave or that there are many challenges and barriers to overcome to enable them to leave their home. If they're going to be there over summer, then they need to have a well-prepared property. So I felt that yes, CFA could assist with bushfire safety advice and help residents who have a disability, chronic medical condition or are older, but I also felt like we could do a lot more. I had some thinking and researching to do. To start with, Tony and I co-wrote a case study about her story. This was completed after consultation with a local MS group that Tony is involved with and us at CFA. And we can circulate this afterwards. But what the case study did is put a voice and a person behind my concerns. It highlighted the complexities behind Tony's situation. She did not have, at the time, accessible transport. She could not find a suitable place to relocate to, even though she had tried. For example, they tried the local shopping centre, who said they did not want to take responsibility for any of Tony's equipment. So Tony herself had come up with her own plans: stay in the pantry and hope for the best, or contact a friend up the road with a horse float who could move her wheelchair and hoist. Neither were great plans in CFA's eyes. But an ideal plan to move Tony on high-risk days takes considered planning and resources. I'd just like to share with you the summary from the end of the case study. People unable to respond in an emergency will be living in areas prone to disaster. They will be in their own home, utilising often in-home care support. And we need to understand that this could be a growing concern across the state. And although carers and individuals are doing their very best to relocate on high-risk days, it is likely this will not be possible in all situations, as highlighted by this case study. CFA can help provide fire safety advice to improve property preparedness for bushfire for people who may be unable to leave their homes due to physical or cognitive limitations and conditions. However, it is still up to the property owner to put these measures in place and to keep them in place. In Tony's case, she has implemented the recommendations of CFA, which in turn alleviated some of the fear Tony feels over summer. CFA also has a specially designed program aimed at educating carers and support workers about bushfire safety, and I'll talk about that in a minute. Although this is up to individuals and care agencies to adopt and is not compulsory training for NDIS organisations and so forth. Advocating for greater uptake of this program and a greater focus on emergency planning is something CFA should strongly support. So that's how we ended the case study. Then in August 2019, I wrote a paper to the CFA Executive Manager of Community Safety outlining my concerns for people at greatest risk and my suggestions for some solutions. I paired it with this case study. And what do you think happened? Apart from having a desk that looks a bit like this desk in the picture, it's much better now actually, but it was piled up with research papers and reports and policy review documents. So apart from a messy desk, what actually happened? Well, the paper's recommendations were accepted as a priority to CFA community safety, and funding was sought to turn the paper's recommendations into a reality. So in September 2019, I got the green light to go ahead and write a project plan for a 3-year funded project, finishing in June 2022. The Preparing Vulnerable People, or PVP project, was born. The project has 2 overarching objectives. So the first one, you can see on your screen here, to build the capability of the health sector, or part of the health sector, and community and social services sector to support their clients at greatest risk with bushfire planning. And then the second objective, to target delivery of CFA fire prevention and preparedness services to people at greatest risk alongside local service providers and local government. The good news is, really good news, is we're not doing this alone. So we've put together a statewide stakeholder reference group to help guide and advise the project. It is super helpful as it brings together the emergency management sector, what I call the EM sector, and some of the community and social services sector to have some really important conversations. So you can see here up on the slide all the logos of the organisations involved, like Red Cross, VCOS, National Disability Services, NDIA, and Disability Resource Centre as an advocacy group. And then I also have an internal CFA working group, the worker bees, behind the scenes, doing all the work in the background. So the building capability arm of the project focuses on CFA's Fire Ready for Community Service Providers program. It's a bit of a mouthful. That's the title of the program. And this program recognises that community and social service organisations are often in the best position to have conversations with their client, or in the case of NDIS and managing your a package yourself, to their employer about bushfire risk. So CFA just wants to help arm people in the sector with the information and skills they will need. The revised program will be launched in 2 weeks' time on the 11th of September. The program consists of 2 sessions or modules. One focuses on the safety of the worker and the other on the safety of their client or patient. Each session runs for 45 minutes, either through accessing an e-learning module or a CFA face-to-face session, which would, in normal circumstances, delivered face-to-face, but at the moment, we can do that online as well. CFA has actually been delivering this program for over 10 years. However, the PVP project, this current Preparing Vulnerable People project, has allowed a much needed facelift. The new e-learning module gives organisations and workers more flexibility to complete it individually and at a time that works for them. And the development and testing of it involved a whole host of end users. Importantly, the revised program uses the Person-Centred Emergency Preparedness, or PCEP, framework and recognises that people's levels of preparedness can differ, and this can affect how they understand and how they plan for bushfire. The new e-learning module and resources aims to put conversations at the heart of bushfire planning. So here on the screen, you can see some of the new resources, both the title screen for our new e-learning module, Bushfire Planning and How to Support Your Clients. But we've also invested in a new guide for community workers to support all the learning from the new online module. The guide has a section about the importance of person-centered conversations, and we worked with Michelle Villeneuve on this. Thanks, Michelle. There is also a new bushfire planning template for individuals, and it has been converted into a large print version thanks to Vision Australia, and it will also be available up on the CFA website from the 11th of September with the other resources. Now here you can see question 5 in the template asking about how you will get to your destination when you leave. Now, Tony's circumstances have taught me that organising transport can be challenging for someone who needs an accessible vehicle or who has specialised equipment to move. I understand now that a car is not something funded through NDIS, unless this has changed lately. So this is an area that needs some pre-planning and perhaps a local solution, and one that is not cost prohibitive for the individual. And of course, there is a question of, well, where are you actually going to go? And finding accommodation that is suitable. This needs to be thought through and planned for. We're going to look at a short film next that hopefully highlights some of this to you. And this short film snippet captures some of the issues encountered last summer by Delwyn, a resident of Lakes Entrance, who was looking for somewhere to go. And it takes 2 minutes. So I'll see you in a minute.
I live alone and I'm disabled. When my nephew said that it was a good idea to go to the evacuation centre, I just hopped on my scooter and drove down there. They were unable to accommodate me because I can't walk. They had mattresses on the floor. I obviously couldn't get down to that, or if someone helped me down, I couldn't get up.
And so I came across Del, who she was right here. She was unloaded from a maxi taxi in her electric wheelchair and was just sitting there in her chair and not knowing what to do and where to go. There were no motel rooms, there was nothing available, and so I thought I'll just try a bit further afield and rang an information line in Sale and got onto the Freemasons homes in Sale, and the woman there that said that she had a bed.
So these experiences, like Delwyn's and Tony's, they really help us at CFA to understand the planning requirements for people with a disability. This short film has actually been created for the new e-learning module to give a lived experience perspective, because it is so important to understand. Okay, I'm going to move on now to the next objective of the project, which I mentioned earlier, which is the targeted service delivery directly from CFA, or what this title of this presentation is, Person-Centred Risk Assessment. This will centre around a property visit and direct engagement. That is, a CFA person if you would like, we'll come to your house. And when I researched nationally what was best practice in assisting people with a disability to plan for emergencies, the PCEP framework kept coming up. And the more I read, the more I liked it. And we've already just heard about why that is from Michelle today. So at CFA, we already have trained facilitators that work in community engagement, but we will do some specific training to ensure they have the skills needed to have a person-centred conversation or conversations. The conversations they will have will focus on the capability wheel that Michelle introduced earlier. And as you can see, it is on this slide again, and it's taken from the PCEP framework. It will guide the conversation to focus on fire safety, both bushfire and house fire. CFA already delivers a property advice visit service, delivered to over 55,000 people since 2014. And those good at maths can work out an average per year. This program has recently had a full evaluation. The evaluation highlighted that the program is largely successful. I'm just going to have a drink so I don't cough. That's better. So we recently evaluated this program, and the evaluation highlighted that the program is largely successful. Individual property visits are well received and are resulting in the majority of people taking action. So now we want to combine the best parts of this program with our new program. So the existing program will then be mixed with more of an equal conversation style or a person-centred approach where the resident is recognised as an expert in their own lives. And we will purposefully target people on the Vulnerable Persons Register and also people at greatest risk who are not on the register. Of course, people can also self-refer themselves to the service once it is available. But the reason we want to ensure the people on the register have access to this program is because, well, the simple reason is they are listed there for a reason, and we know evacuation is not always going to work in the response phase. In fact, Tony once said to me something that will likely stick with me for a very long time. She said, "The reason for the Vulnerable Persons Register is so police know where to find my body afterwards." This was one of those moments, you know, the ones that stop you in your tracks, and it made me think, what role can I play to make sure this is not what people think or what actually happens? And so we really need to focus on preparedness planning with this program. And given people will be at different stages of preparedness, we plan on doing a follow-up visit or phone call, or perhaps a few. We'll need to have a number of conversations. And we've had a great offer from Red Cross to assist with this program. Understandably, they are super busy at the moment with the response to COVID. So we will just be flexible to allow for co-delivery if possible, or sharing some follow-up with either CFA or Red Cross. And now we're just waiting for COVID-19 to settle down so we can begin the trials of this approach in a few municipalities. The aim is to trial, monitor and evaluate this approach this financial year, so before the end of June. The trials will highlight what is needed for this to work on a larger scale. It will be a more complex program to coordinate and deliver than our current property advice visit program. CFA will need to work in locally with the municipality and local service providers. The strength that CFA brings to this approach is that we are community-based already. We already sit on local council emergency management planning committees, and we can be flexible to tailor the approach to meet local needs and individuals. Once again, I think it's important to mention that this project has a statewide reference group. We're not going it alone. But do we have everybody that we need in the group? Probably not, but it's a pretty good start, and we've added and grown over the past 9 months. It has really helped me understand the sector and understand what is needed. And I also have a CFA working group that has CFA members with lived experience of a disability and a super project officer with industry experience. Understanding what people need who have lived experience of a disability is critical to the success of this project. This is why experience is super important to this project and to me. We want to be able to enact some positive change and focus on solutions. We need to understand how we can improve preparedness planning for people with a disability. Tony reminded me last week to recognise that we could wake up one day and our world could totally change with an unexpected diagnosis. This is what was Tony's experience. Going from a functional, happy existence as a psychologist advising government and appearing in the Supreme Court to an MS person, and then to a widow with MS who is often not even listened to. Her story and experience are a constant reminder and motivator for this project, and for that, I am very grateful. And because we are lucky enough to have Tony taking part today, I'm going to ask her a few questions before we move on to other questions. Hi, Tony. Good to see you, Tony. Thank you for today. I'm so glad you're here. I'm just going to ask the question, Tony. Is that okay? Take a deep breath. Okay. I'm sorry, Tony. So, Tony and I actually talked about this a bit earlier. So I'm just going to give you, a minute, Tony. We'll give everyone a minute. Tony, do you want me to just go through your answers? Or are you okay? Okay. All right. All right, okay. We'll bring Tony back and I'm going to ask a couple of questions. We'll see how we go. So, Tony, how would you describe the barriers to having a bushfire safety plan? Can't hear. Oh, Tony, I can't hear you. Is your sound working? We'll get it working. Can we hear you yet? No? Not yet? Can see you, but I can't hear you.
That's the only one I can think of. Mm-hmm.
Is that better, Tony? Can I hear you now?
I'm not sure. Can you hear me?
Yes, yes, I can. Yes, great.
Excellent.
Perfect.
All right.
Okay, Tony, we'll just start again for that first question. How would you describe the barriers to your bushfire safety plan, Tony?
There are quite a few barriers that you would never think of. But to start with, I would have to deal with the NDIS system, which is quite complex, and I'm not sure how it would work in a bushfire situation. So that's a major barrier. Then there's the barrier of having transport. So once we know that bushfire is looming, what am I going to do to get out of here? And then where will I go? Finding appropriate short-term accommodation is tough. It's not like just jumping in the car and going to any accommodation. The accommodation needs to be accessible. So not only do you need to get your wheelchair in there, but I need all of the equipment that would enable me to be somewhere else. Which brings me to the next idea of relief centres. They are quite overwhelming. So for somebody like me, where there is so much noise and hustle and bustle, and it can be quite frightening. And also I need to take a support worker with me, which is tough during the bushfire season because all of my support workers are living in the same environment. So if the fire is looming, who's to say that support workers will want to come with me? So that's a real barrier. And then on top of all of those, what on earth is going to happen with COVID-19? So I think that provides a good list of the barriers.
That does provide a really good list, and it's the first time we've brought in COVID to that bushfire, into fire as well, and that sort of the double whammy that means. And if our advice is to leave and go somewhere else, but going somewhere else could be unsafe because of COVID, I mean, that is just an extra layer. And for you, Tony, how would you describe your current bushfire plan?
Well, leaving early, as the advice often is very difficult to do. So realistically, I need to stay in my own home. It's set up for me. I've got all of my equipment here. So I don't need to worry about transporting everything to somewhere else, which is a big stressor. And also heat is a major issue for me, and many people with MS might agree that as soon as you introduce heat into the equation, all bets are off. So you really need to stay somewhere cool. And that led me to thinking, well, how on earth would I stay here if fire is looming? One of the first things that happens is you might lose your power. So then I purchased a generator, and the generator would allow me to stay here because I could charge up all of my equipment, so hoists, wheelchairs, everything. Yeah, really, it's all about just identifying what is it that you can control and working very hard to make sure that you're your support is around you, your equipment is around you and will be working. So that would sum up my bushfire plan at the moment.
Yeah. Thank you, Tony. It really helps to understand what support you need to stay safe in a bushfire, what other people will need in similar situations. And I remember having a conversation with the now former chief officer of CFA just saying to me, well, you just need to get these people out. They just need to leave. And saying, well, it's more complex than that. It's harder. It's not as simple. And I doubt CFA's message won't change. It'll likely remain the same. The safest option is to leave early. But I suppose what can we do to help people prepare more, to think about things like generators like you have, so that you have the power you will need for your assistance equipment and things like that. So, and to understand, I suppose, what you can do, which is what you've shared with us today. So thanks so much. Will there be any other questions? Because I'm aware we're running over time.
Can I just say I commend your bravery, Tony, for coming here today and sharing the story. I understand you've relived your trauma, and there's nothing more painful than that. And we all need to collectively do better. We really, really do. But people like you, people like me, everyone else who has a disability as well. So thank you for sharing your story.
Yeah, thank you. Thank you.
Thanks.
Angela, thank you. Angela, thank you for your presentation too. Unfortunately, we've run out of time, but as I said at the start of the whole forum, we are going to be compiling a issues paper because we don't want the conversation to stop here. We want to make sure that action comes from this. So we will come back to you both later on when we do our issues paper and with the questions from the audience as well. So it doesn't stop here. Okay, thank you both very much.
Thank you, and a special thanks, Tony.
Thank you.
Thank you. Okay, everybody. So now we'll go to a lunch break. Please enjoy the Danger Zone playlist compiled by Darius DJ Breaky. Crank it up loud and dance like no one's watching. Have fun and see you back at 1 o'clock. Welcome back, everyone. I hope you have had quite the party in your household over lunch and you are ready and settled in for a cracking afternoon. Disasters amplify the existing fault lines already experienced by people with disability to live an ordinary life. The best way to truly understand the impact of disasters on people with disability is to hear their stories firsthand, as we saw in the last presentation. This session is a case study video showcasing the real-life stories and impact on 3 people with disabilities in the midst of 2020's disasters. Please listen to the stories of Tim, James and Mark.
For those living with disability. 2020 has offered many challenges, particularly for those living with disability. Bushfires and the pandemic have made life difficult for these Victorians. Here are 3 of their stories.
My name's Mark Oakley and we're at Dirty Hollow Creek, Wisely, 20 kilometres east of Bairnsdale.
Ever since we've moved out to this block, we've been aware that bushfires are going to be there for us, and that every year we prepare for it. And this year it was different. First a big plume, then all the birds out of the bush started hanging around the back door and squawking and making a noise. We just felt and knew it was time to go. So we packed up our stuff, and a few hours later everything was gone. It just blew through there from the south and melted everything to the ground, apart from our solar system and batteries, which survived.
30 years ago or so, I got Barmah Forest virus, Ross River virus, which gave me fibromyalgia, and had a bit of spinal damage on my neck, upper neck, and some sort of growth in my spine at the bottom, emphysema, and just had a heart attack a couple of years ago.
Mark's challenges are that the access into the caravan is quite difficult, and showering in the caravan and going to the toilet and things like that is quite difficult. When the bushfires first happened and we come back and decided that we wanted to live on the block, we did ask if there were any services out there that could provide us with a portable shower toilet unit. We're into the 8th month now and still no sign of a shower or toilet block.
We've been very fortunate that we've been donated a shed by the Red Gun Church in Bairnsdale. Because of all this red tape and all the hoops you got to jump through and all the paperwork you got to do, help from the disability services, we haven't had any. I cannot see why the government organisations couldn't have actually helped us more with Mark's situation.
Psychologically, getting back to my place was a big thing. I just wanted to be back there and give me peace of mind one way or another. And then after that, the amount of paperwork and phone calls and meetings and things becomes confusing as to what you're supposed to actually be doing, and the actual personal need seems to be overrun with furniture and clothes and things. I need a toilet that I can sit down on properly, and a shower that if I fall over I won't break through the glass, or that Jane can wash me and help me. Not getting those facilities makes it rather difficult and a bit more dangerous for me, so I don't shower as much.
COVID has made it a lot more difficult. When the pandemic started, we were living at the caravan park with my mum in her little unit down there, and we weren't quite ready to leave there and go back to the caravan. We hadn't set up a few little things that would make life easy. And then the pandemic started, and then the owners of the caravan park said that we would no longer be able to stay at the caravan park because we weren't a permanent resident, so we had to move into the caravan, and we just had to cope the best way we could. Mark wants to see his last days there eventually, and that's his wish, so that's why we would like to rebuild again.
We're connected to it, and I just can't let it go. We can't let it go.
Tim Chan has been in lockdown with his mother Sarah in Melbourne.
My brand of autism means that I am dealing with a body that is not always in sync with my intentions, so it is very challenging to go through daily life. The pandemic has brought unprecedented changes to routines, on which I rely heavily to manage my constant anxiety, which has skyrocketed. So life is difficult because I miss the connection with people. I suppose this is true for each person, with or without disability. However, because I use non-conventional communication, assisted typing, it's not easy to connect as it takes trained facilitators with whom I have a personal relationship before I can output typing. So I am feeling especially alone and vulnerable.
My name is Sarah Chan. I have a son, Tim, who has severe autism. And we've been in lockdown, which is having an impact on us. And support workers are not really able to maintain their presence in Tim's life. So it's been quite hard for all of us.
My support workers are my friends as well, because they facilitate my type-to-talk communication. It has been lonely. My mum, who I live with, has to take on all the care and supervision of my daily routines and activities. Because she has been without any respite or support, this is taking a heavy toll. Both lack of sleep and anxiety have been the cause of more seizures. I am also afraid of hurting mum or myself when I have fits, in case I fall onto her, or when she has to physically keep me from falling.
Tim's 25 at the moment. He was diagnosed with autism at the age of 3. He is a non-speaker. He never really achieved speech, despite a lot of early intervention. He's very dependent on me, as you can see, especially in the present condition. He needs that one-to-one supervision and attention, support at all times. So I'm sort of pretty much a full-time parent, very full-time parent.
Diversity. I think people can be educated to be more aware of differences in neurodiversity. Government has been very ableist in their thinking. They should include disability voices. Find alternatives to incorporate our perspective and listen to us from different viewpoints.
During lockdown, it's very hard to connect with people in face-to-face situations, but hopefully when the pandemic ends, community groups and organizations can provide opportunities for people with disability to come together. And I think it's very important to talk about your experiences with other people who have experienced pretty much similar things. We've become very resilient. COVID-19 is something that we need to go through, of course. But I think with all the experiences of the past, it's built us up, to do that.
James Griffiths has found life in 2020 increasingly isolating.
My name is James Griffiths. I live in Sale, Gippsland, Victoria. Volunteering is my everything. It gives me something to strive for, and it gives me happiness. It's food for my soul. The bushfires and this pandemic has made me feel pretty useless. I'm trapped in a black box. Staying at home now, I'm stuck in 4 walls in a black box. Can't get out, can't do the things that I'd want to do. Today for this interview, this is the first time I've been out of the house in a couple of weeks. A little known fact about myself is I'm a double transplant recipient. Being immunosuppressed, I've got to be very careful on where I go, what I do, how I touch things. During this pandemic, I've noticed there's been a reduction in services. Where I used to be able to walk into my local council and find out information, most times now, it's all over the phone or it's all via Zoom. All this new technology I've got to learn. It's not impossible, but it's really, really hard considering being blind and not knowing much about technology in the first place, and then having to try and learn the new technology to gain the services that you need. So I'm feeling right now that having a disability, I'm left right out of the loop. Facebook, for example, there might be a picture that's been put into a post. Then on my screen reader, I can't read that because it just says picture may contain text. Not all those things are completely accessible. And it almost seems like it's a hassle for a lot of organisations to do it, and they get frustrated, but it shouldn't be an afterthought. It should be the first thing that they think of. How can we make this information accessible to everybody? Every day I hear there's been 300 new cases in Victoria. No, there's been 12 more deaths. No, there's every day. And it makes me wonder, if I go out, am I going to be the next one of these 300 new people with COVID? Everybody's asking, we want to hear from you, we want to hear from you. My message to change makers is, get your head out of the sand. There's a lot more that's happening out there. You just need to look for it. Don't forget us.
Powerful, wasn't it? So let's go to a panel of experts to discuss. Remember to put your questions for the panel in via the Q&A box. Who best to lead a discussion than the amazing Bridget Tehan, Policy Officer of Emergency Management from VCOS, who will guide our panel of experts through a discussion about all we've heard today. Welcome, Bridget.
Thank you, Melissa. Thank you for that lovely introduction. It's made me smile and it's made my day. I just wanted to really firstly start off by acknowledging you, Melissa, and the amazing work that you've done and all of the team in pulling this together. It's just been so incredible so far, what we've heard. And I really wanted to, acknowledge the work of Michelle and Angela with those really practical projects on working with people with a disability around person-centred emergency planning and preparedness. So actually encouraging people to own their own plans, being best placed, of course, to do that planning. And secondly, Angela's project, which she discussed in the second session or in the third session of this morning, and looking at the Country Fire Authority, or the CFA as it was then, and an amazing project that Angela's undertaken, looking at supporting bushfire planning for people with additional needs and working with local community organisations to undertake that work as well. So, really extraordinary work going on right across Australia. And look, I don't have doubt that there are many other projects underway as well. I'm really pleased to be here today and to be supporting this forum. And enough about me. I don't want to talk too much. I do want to say, though, well done to Tony for appearing live today. We could just see that was a really, really tough thing for her to do. And I want to pass on a huge congratulations from not only me, but from the many, many people that commented as you appeared live, Tony. You did just such an amazing job, and the messages that you imparted were really profound and really meaningful, and will hopefully make a difference for other people with a disability. So what I'm going to do today is not do too much talking. We have a fantastic lineup of panellists here, and I know that we're all keen to hear from them. So who we have with us today is Christina Ryan, CEO of the Disability Leadership Institute. We have Adrian Terranova, Executive Officer of Gippsland Disability Advocacy. Michelle Watson, who's a Coordinator for Community Programs, Aged and Disability Services, and is the Deputy Municipal Recovery Manager at Yarra City Council. And again, we have Angela Cook, Project Manager at the CFA. I just want to start out by saying that emergency management is really complex. An emergency event might need the help of police, firefighters, ambulance, rescue or life-saving services. If it's a bigger event, it might involve a local council and other organisations. And a really big event like COVID-19 might include the whole of the state government. And the frameworks under which emergency management arrangements operate are also complex, and they do tend to focus on those emergency services and governments, as I mentioned above. There is a move to community-led emergency management, where communities and community members are involved in all aspects of emergency management, from planning and preparedness through response and relief, and right through to the longer-term recovery process. But we know that people with disabilities are isolated from the mainstream community on a day-to-day basis and face significant barriers in participating in everyday life. So how can we make sure at the outset that they're an integral part of this new community-led approach? Each of our panellists is going to share some of their experiences and reflections of emergencies and propose some real ways forward on a whole lot of different levels that can kind of feed into this complex emergency management arrangement. I'm going to start off by introducing Adrian Terranova, who's the Executive Officer for the Gippsland Disability Advocacy. Adrian, if you would like to tell us a bit about your experiences and your organisation's experiences in both the 2018 as well as the 2019-20 bushfires and some of the challenges that you've faced in undertaking that work, and I guess particularly with regard to funding, which I know has been really troublesome for you. Over to you, Adrian.
Yeah, thank you, Bridget, and good afternoon, everyone. I'd like to just acknowledge that I'm meeting on Gunai Kurnai land and pay my respects to elders past, present and emerging. It's been a wonderful forum. Thank you, Melissa and the team at Daru for facilitating. So my name's Adrian. I work with Gippsland Disability Advocacy. My role's the Executive Officer. I might just quickly, if I may, just talk a little bit about Gippsland Disability Advocacy. We're the regional service for Gippsland, and our mission is to advocate, promote and be responsive to the welfare rights and interests of people with disabilities and to build a more inclusive community. So once we're talking about emergency management, you can see that this is front and centre. I think what happens with emergencies is initially we go into a little bit of self-preservation when there's bushfires and things like this, and instantly we start thinking about ourselves, our family, our friends. And very quickly, we then think about who may be impacted. We then think about our community, where we're working, and instantly you see and know of a number of people working disability advocacy who would be really, really in a lot of situations where there could be a lot of problems. So as a result of that, we across East Gippsland on the 29th, 30th, and 31st of December. There was a number of community meetings, and we just felt, now we're in Lakes Entrance, Bensdale, Bruthen, Meetung, we just felt it was really important to have presence and know what was happening at the community meetings so we could at least start engaging with our community for people with disabilities. From the 1st to the 10th of January, our organisation had presence at the relief centres, which were established across the region. They initially started in Bensdale and then East Gippsland, and then that flowed on down to Sale and Morwell. On one day alone, we worked with 19 new clients across those relief centres, and it's fair to say that there was a loss. There was a feeling of isolation, a lot of trauma with regard to that. We just felt it was really important that as a disability advocacy service, that the voices of people with disabilities were heard at that point in time. The issues were really wide and varied. From departmental grants to breaking down the barriers to accommodation, as my colleague Denise had mentioned earlier. So lots of different situations. But look, throughout this time, it was high intensity. Certainly, a lot of engagement through our funding bodies, being the Office for Disability as well as Department of Social Services through the National Disability Advocacy Program. They were very keen to know how we were encountering. What I will say is we certainly had a good opportunity to be able to talk to them, but without the support of Mary Mallett at Disability Advocacy Network Australia and the senior management team at VECOS, we may have struggled somewhat. So they were wonderful in breaking down those barriers for us. We also had really, in saying about the support, Paul Malavasi from the Office for Disability took a very special and keen interest about the work we were doing, and we're really supportive of that. Look, difficult time. You're talking about the 29th, 30th, 31st of December up to the 10th of Jan. We had lots of staff on annual leave. we were really blessed that Denise Lamble, my colleagues Denise Lamble and Sam Gamlin, who is our systemic advocate, were willing to come off from annual leave and do some work at the relief centres. What I think there's a couple of things here which are really important is I spent a lot of the time at that time advocating, and it sort of took me away from being where I needed to be, was advocating that we got some systems-based scenarios and problems here, and what it's led us to continue to think about is a contingency fund that organisations like ours who can evidence that we're in this space, that governments can start thinking about supporting that, because it was like everybody got caught short and found out by, oh, a disability advocacy organisation is at the relief centre, as like it was something out of this world. From our perspective, we found it imperative that we were there, and I would advocate for my colleagues across the state and country that the disability advocacy organisations need to be at relief centres. But it did show up a few flaws in that, you know, from a contingency point of view and funding, how do we make this happen? One thing else I'll just say is being locally and place-based is really important as well. We had a situation where our systemic advocate had really good intel and knowledge of the local Gippsland Grammar School, which obviously had accommodation on site there, which was very accessible. We had a family in East Gippsland who were wheelchair users, who we heard from Denise earlier on, there was no accommodation available, but importantly needed to be accessible. Sam was able to join the dots. So a local place-based organisation was really able to connect in. So yeah, look, we could talk about it for hours and hours, our work, and we're really passionate about it, but there's just some things that really stuck, you know, just being local, being place-based, knowing our community, being able to build the links with what was available with regards to accommodation, but also the gaps regarding contingency funding and the like. So, yeah.
That's great. Thank you so much, Adrian. And I think you've kind of undersold your story in terms of the role that you did play in supporting people with a disability through those fires. I know for one that you went absolutely above and beyond. I know that your organisation was, you know, scrabbling at the very bottom of its bank account to continue doing the work that you were doing. And a real credit to you to just to be there for not only for your community, but for local people with a disability. And I think it really shows what disability organisations can do and the role that they can play really at the forefront of emergencies, right in that response and relief phase. But they do need recognition, they do need support, and they do need the funding to be able to do this effectively. Thanks so much, Adrian, for sharing, and I'll come back to you a little bit later. Michelle, I'm really keen to hear from you from your perspective from a local council, from a local government, the City of Yarra, and the work that you do and the insights that you've got around working with and for people with disabilities in an emergency management context. Over to you, Michelle.
Thank you, Bridget. Like Adrian and everyone else at this forum, I hope you can hear me okay. I'd like to acknowledge the Wurundjeri Woi-wurrung people. Oh.
I think you froze there for a minute.
I think
Michelle.
I have. I can hear you, Bridget. I don't know what. Can you hear me? Okay. I've got some other audio happening. Oh, I'm going to.
Just continue on, Michelle. We can hear you loud.
Okay, it's just all right. I'm going to take this off.
What are you doing? The insights that you've got around?
I'm really sorry. I've got some weird delay playback happening.
I think you might. Thanks, Michelle. I think you might have the forum actually streaming perhaps through another screen.
Okay.
So if you switch that off.
Apologies, everyone.
Great. The joys of technology. We've all done it.
All right. I think it's gone.
That sounds better. Over to you, Michelle.
Oh, phew. Oh, my apologies, everyone. I don't know how, that's embarrassing. But as I was saying, I'd like to acknowledge the Wurundjeri Woi-wurrung people, who are the traditional owners of the land we know as Yarra, and pay my respects to elders, both past, present and emerging. Thank you, Bridget, for the introduction. It's been, as always, a very busy time for local governments, and I think before I talk about my experiences, I'd just like to acknowledge what a valuable and learning experience this forum has been for me, and I look forward to many more opportunities where we can hear people's voices and stories and experiences so that we can take them on board and learn from them and build that wisdom and knowledge into our practice in emergency management, because I think there are incredible strengths, resiliences, knowledge and passion in the disability space that we can learn about what is working, what's acceptable, and what the gaps are for our communities and where we need to improve. So at Yarra, a lot of the planning, I suppose, there are different stages to emergency management, and I think I'm quite proud of the fact that our planning committee, the Municipal Emergency Management Planning Committee, has representation on that committee with a person with disability, which helps bring insight and understanding to our planning processes, which is just awesome. I would encourage every local government to have that representation at the planning table. I think in response, a lot of our focus and efforts have been around the food safety and food security space. I think we all saw what happened in North Melbourne and Kensington, and how quickly COVID-19 can really impact on everyone in the community, but the extreme impacts it has on people that have difficulty isolating or participating in the community. And I think one of the strengths that I suppose observing what happened on the media and the news, and it's always, take it with a grain of salt, but I think some of the lived stories that we heard about were really, really appalling. And I think we leveraged that understanding and knowledge. Well, we need to do better in Yarra as well. And right from the start, we were establishing community forums and meetings a couple of times a week to hear what was needed from the community, what was working, what wasn't working, and what could we do differently. One of the biggest, I think, issues we experienced in listening to community members, and that includes people with disability, was that the 1-800 numbers really didn't work for a lot of people in the community. And a lot of the information out there wasn't working for people with disabilities. So we looked at establishing some supported referral pathways that specialist agencies like those in the disability sector could fast-track people needing support or additional support for us to work with and link into those supports. And that's been a very effective strategy. I think we've had about 36 referrals through that pathway where, the 1-800 number just hasn't really worked for them. And, anecdotally, people were on hold for over an hour, giving up and just, trying to make do as best they can when there were supports and assistance available. So that was a really good learning that we got from the community, but also I think using the community leaders is essential in getting the messaging out and in simple ways, and also assessing what people needs. Now, I remember Anne, there was a question to Anne Kavanagh right at the beginning of this forum about what work was done with local governments in the high rise at North Melbourne and Kensington. And I suppose part of what we get from the health service is tricky. We do get information about people needing supports in the high-rise, but because of privacy and confidentiality, we don't get specific information of those people. So we actually rely on people giving their consent, and then our staff can follow up and find out what the needs are and what the supports they're requiring to either self-isolate or get retested or have, you know, access to a test are, or what their needs for PPE are, and then aim to deliver that to them. So, I mean, we had some interesting requests. So it wasn't just about food. It was, we had one person who with disability who had broken their arm and they couldn't brush their teeth and needed an electric toothbrush. So we were able to supply that. So I think, it's not easy because of privacy and confidentiality. And I think that going back to where I started with having those conversations and meetings and forums with the community and community leaders and agencies in the community, and leveraging off those strengths and connections and partnerships enabled us to use them to do a lot of door knocking. And with interpreters and Auslan interpreters if we needed them, to actually find out what was happening and what was needed on the ground. I suppose that's in a nutshell. I think just a personal reflection. I think COVID-19 has given us all a small taste of what it's like to be unable to access or participate in our community, and how that impacts on our well-being and our mental health. And my hope is that we can use our COVID-19 experiences to do more to empower people with disability to live well and be safe in our community once this is passed.
That's great. Thank you so much, Michelle. And it certainly sounds like the City of Yarra does amazing work in working with its very diverse community across a range of areas, and great to hear some of those really concrete examples that you've been able to share with us. And great also that you're, you're sitting there saying, we've got more to learn, we can do it better, we can improve, and to be part of this discussion today, it's really fabulous. I'd like to pass over to Angela Cook now from the CFA. Angela gave us a presentation this morning about the work she's doing with the CFA on supporting people with vulnerabilities to prepare and plan for bushfire, and working with community disability organisations who support people with a disability to support that planning, if you like. So I'm not going to get Angela to go over the details of her project again, but she can certainly touch on them. But Angela, I'm wondering if you've got any further reflections based on what you've heard today and what you've seen today from the various presenters and people with lived experience. Over to you, Angela.
Thanks, Bridget. I think, like I said in my presentation, that when I did some research about what is best practice in Australia and nationally for working with people who have a disability around preparedness planning, the person-centred emergency preparedness approach kept coming up. And then I contacted Associate Professor Michelle Villeneuve from the University of Sydney, and we've been working with her, and I think that's been fundamental in shifting the project in a way. CFA already has, I think, a reasonable focus on community engagement, and we run a number of programs, but I don't think we always focus it down to that level of the individual and in a person-centred, guided conversation way where that individual feels empowered. We often come at it with more of an expert-led approach. Here we are the fire service, we know what you need to do, and here's the list, and we just tick it off. Now, but we actually know we want people to take ownership of the risk and what it means to them, and how their capabilities affect that, then yeah, we definitely need to utilise that more of that person-centred approach. So I think that's quite critical. The only time, and that will work really well in the preparedness phase, when we get to response, that doesn't work so well. That's where we're just telling you what to do. So I was kind of thinking, as an emergency service, we need to be really clear that, hey, in this preparedness stage where we can really have these person-centred based conversations, that's where we need to be. But unfortunately, when we get to response, we're not always going to be able to do that, unfortunately. So that was one thought in my mind about how this needs to happen before. Another thought was around how CFA, we tend to focus things at a community resilience, trying to do a lot of our programs at a community level. And I wonder in how we do that, we don't reach everybody, not everyone can come to that community-based kind of sessions. So part of my thinking was, how do we be more inclusive with that, with our community resilience-based programs? So they're the kind of things that I'm thinking about. So I was really interested in the project that Michelle is doing and what Queensland has been doing. So there's some of my reflections. I don't know if anybody else had something to add from the group here about that.
Look, I'd certainly echo what you've said, Angela, and I think that the people that we've heard from today, the people with lived experiences, the videos and the footage, and Tony and her presentation have made it really evident to me that we aren't the experts. Us in emergency management are not the experts. People with a disability are the experts in their own lives, in their own strengths and their own needs. And what we need to do is to make sure that they're at the table as we work to embed disability inclusion in all of our approaches to emergency management, whether it's planning, whether it's response, whether it's relief, or whether it's recovery. Adrian, you've got your hand up. Did you have something you wanted to?
Yeah, I just wanted to reiterate some of those thoughts. Like, even I went to a community meeting as this was happening, as it was New Year's Eve in Lakes Entrance. Instantly when I walked in, it was like, I don't know how accessible this venue is, and I'm not sure how accessible some of the language, and there certainly wasn't the thought about plain or easy English. And again, it was a highly stressful time for all the community, but that was something that just an observation, and it was like, well, yeah, it sort of was a bit confronting as well. The venue wasn't so accessible. It was a bit of everything, all of the above captured in.
Great, thanks, Adrian. Thank you, Angela, for that. Really great to hear your reflections based on what you've heard and seen today. I'd like to introduce Christina Ryan. Christina, of course, is the CEO of Disability Leadership. Over to you, Christina.
Oh, thanks very much, Bridget. The Disability Leadership Institute, and there's a couple of other things that I've done which might be relevant, but firstly I will acknowledge that I am on Ngunnawal land, beautiful Ngunnawal land, and I will also mention that I openly identify as a disabled person. So a couple of other things that I've done in the past have been coordinating the community sector response when I was working at ACT COS, when we've had a couple of major disasters over the years. And I have also run an advocacy organisation, so I know Gippsland Advocacy well through that, and for some period of time I was the chair of the Disability Advocacy Network of Australia. So I'm bringing all of that into the conversation this afternoon, and I think we've touched on some really important things here. One of them is that if disabled people aren't in the room, it's all about retrofitting, and by the time we get to retrofitting, it's a bit late. What we've learned this year particularly is that things can go wrong, and they can go wrong fast, and they can go wrong in multiple occasions. And so we've started the year, in fact our year started last spring when we were all starting to deal with responding to bushfires and They seem to go forever. There were horrific hailstorms, floods, all sorts of things that have happened before we finally landed with a pandemic. Excellent. So what that's shown us is that if we try doing our consulting, and if we try get out there and talk to people with disabilities once those things are underway, well, it's too late. Angela's talked about bringing people into the room early. Michelle's talked about having somebody on the emergency committee. All of these things are the ways that we need to be doing things, and traditionally it hasn't happened. Even what Adrian has mentioned about having accessible relief centres and evacuation centres, and we had multiple examples over the summer of people evacuating to centres, and they might have been wheelchair accessible, but people couldn't get to the mattresses on the floor, or there was nobody, that places were so noisy that people with sensory overload really struggled, so all sorts of things started to come into play. And what it's telling us fundamentally is we can't just forget about disability until, somebody turns up at a relief centre. That's the absolute end point. We did learn during the 2003 bushfires in Canberra a very important lesson. The people who are connected to existing services are the ones who get remembered. The service providers know them, the advocacy organisations know them, and even if they're not current consumers, there's somebody who's going, hang on, what's happening to so-and-so? It's the people who aren't engaged with the service providers or the community services in one way or another. And that's actually a larger proportion of the disability community than we realise. It's only a very small percentage of disabled people who are engaged with services on a regular basis. And so making sure that things are going to be suitable for the broader community is about that planning, the pre-work, making sure that the committees are in place, that it isn't about consulting, it's about having people in decision-making rooms. It's about being part of government, non-government, fire response services. It's a part of being in those spaces. And something that we have also learned is there's a lot of scenario planning and work that the fire authorities go through off-season. They do a lot of work to make sure they're ready for the next summer, or most of the year as it's turning into being these days. And that is where we need to be in those scenario planning situations. We need to make sure that disabled people are included so that we're remembered. And it's not about, some passing person with disability in the street suddenly becoming an expert in all matters disability. It's about having enough of a presence that disability isn't forgotten. People know that they have to go and find the information. I'm not the specialist in the deaf and hard of hearing community. I would need to speak to them to understand exactly what's going on. I do have a broader range of understanding than most people in the disability community because of my work history and what I've done in the past. But we need to recognise that it's the ground-based experience so that those individual solutions can be arrived at without it being an afterthought. It needs to be something that we're almost ready for in advance. So it is about being in the room early and making sure that we factor disability in right at the very front end of any talk about disaster responses, emergency responses. That way we won't be forgotten, and we'll potentially have a wide array of solutions and flexibility, a much greater capacity for flexibility. And that's what we really need to be looking at.
That's fantastic, Christina. And from my perspective and the work I do at the Victorian Council of Social Service, I couldn't agree with you more. I think it's really critical that people with a disability, the organisations that support them are there from the very outset, that they're included in decision making at local levels, at state levels and at national levels. And, the strengths and needs of people with a disability are really built in from the ground up, so that it's not a question about whether their needs are going to be met. It's just part of the process from day one. And I'd also advocate that that's true of a number of different sectors within the community sector. So, for example, organisations that support culturally and linguistically diverse communities, that support Aboriginal communities, and other key groups that may be additionally vulnerable or have additional needs when it comes to emergencies and disasters. Look, this is a fantastic discussion so far, and I'd love for us to talk for the rest of the afternoon, but we will run out of time if we're not careful. I'm really keen to suggestions about something that could be implemented really quickly. If you had a pot of money or somebody had a pot of money that could be thrown at something that would make a tangible difference to people with a disability in your community come the next fire season.
Yeah, there's a number of things. Look, I think initially what needs to occur is each local council has a disability action plan. Some of those disability action plans have greater details across different councils than others. Some are outstanding with their level of information. Others, it appears that they've just really, it's a tick and flick. We do it because we have to. It's a mandate, and they have a disability action plan. We'd be advocating that the disability action plan actually has some responses with regards to emergency situations. Now, that won't need any additional resources or money. It just needs organisations like the local disability advocacy organisation engaged in the disability action plan, but importantly being peer-led, so having people with disability as part of the reference group that is developing the disability action plan. That's just, it's a no-brainer, and it's something that Christina has certainly touched on. But if particularly in these times, if disability action plans were reflective of current pandemics and bushfires, that is a start, because it's at a minimum, it's getting councils thinking about the situation. And I loved Christina's discussion before, that disability and accessibility shouldn't be an afterthought, and James alluded to that in his lovely vignettes video, which was really powerful, as they all were. But I felt, it's really important that we're not an afterthought and we're actually at the table, and that's a key take-home message. We can talk funding, we could talk all different areas, but there are things that don't need funding. It just needs community conversation.
Fantastic, Adrian. Thank you. I really love that idea about community conversation, bringing these things to light, making these things visible, having community members understand that, the people that might live next door to them, have got different challenges and may face different risks and vulnerabilities in the context of an emergency. Fabulous suggestion and very achievable, Adrian, with regard to disability action plans as well. Thank you. Michelle, what about you from a local government perspective? 2 or 3 quick wins.
Totally agree with we call our disability action plan an access and inclusion plan. But I think sitting alongside that is at Yarra we also have a disability advisory committee that provides advice and support to all our business functions on how we can improve the wellbeing of people with disability in our community, but also their carers, and that could be in universal access, be inclusion, and what best practice is, and aim higher. Just always aim higher. I think for me, a quick win would be, when we look at our emergency management system and apparatus, is everyone in that space actually disability awareness trained or had that awareness training? Because I think until you hear the stories and can appreciate what that experience is like from someone who's lived it, you just don't get it. you just, it's not in the front of your brain. It's not something that you even necessarily, I mean, it's not that for want of not knowing, it's just, I think that awareness is really important, and having the opportunity to hear people's stories and understand what that is like, and have empathy and use that knowledge and understanding to improve our practices and our processes and our systems is critical. And that's an easy win.
Great, thank you so much, Michelle. It certainly is an easy win and a very cost-effective win as well. And I'm really liking these cost-effective approaches, even though I suggested there was some mythical bucket of money ready to be thrown at you. Angela, what about you and the CFA or emergency services more broadly? I guess one of the things we know within the emergency management sector is there's lots and lots of fabulous pilot projects of things that can make a real difference, and they're really exciting, and there's all sorts of learnings and insights, and then they're finished and they're packaged up and they're popped on a shelf, and there they gather dust. So how can we make this live on?
That's a really good question, actually. And why do things end up on a shelf gathering dust? Perhaps, I don't know, people might move on. I wonder if there's an issue with continuity and relationships that exist and things happening between people rather at a, I don't know, organisation or systems level. So practical solutions is something I really enjoy figuring out. I think we're very practical at CFA. We're on the ground. We have thousands of members on the ground who deliver community safety, community engagement. Less so at the very minute at the moment with COVID. We're doing a bit more online, but the fact is we are out there, we are in the community. So solutions, there are many, and I think you said 2 to 3. So now I'm thinking, oh gosh, how do I fit this in? For me, I think is planning and preparedness conversations is number one. We need to be having those conversations and thinking about how we can have those conversations with different groups, people with disability, and how I think there's Community Safety Month usually comes up in October every year. Perhaps that's a way to brand it and have conversations. And we have a bushfire season every year, so surely we can have conversations leading up to that. I mean, that's around bushfire safety, but of course there's house fires and there's floods and a whole range of emergencies. So I think conversations are really the heart of how we do that. We've put together some new resources. That's always practical. Resources are very practical. And they're available. They will be available on the CFA website in a couple of weeks' time when we launch. Unfortunately, this is just coming a little bit early, just a little bit before we launch them, but they'll be ready pretty soon. And what we've done is we've got some resources. So what we're trying to do is help people help themselves who may have a disability and who either can access and do this, do a plan on their own accord, or who may need some support through their through carers or support workers. So we're looking at resources for both, and I think I talked about that in my presentation. What we need, I suppose, to make that happen is a sector or organisations, all our disability service organisations on board and enthused about conversations around bushfire. So I get it, I'm sort of marinated in it around bushfire safety, but how do I get others, I think, excited about bushfire when we're currently all marinated in COVID, but soon we're going to have to move into that pre-planning. So there are my thoughts. I'm feeling that if people want to learn more, from the 11th of September, they can jump on CFA's website. It'll be on the front page to link to some of the new resources for workers who work in this space and also for individuals. And then internally for CFA, because I think who was it who just mentioned that just prior to me about some disability awareness kind of training. Well, CFA has purchased the SBS training packages around building inclusive organisations. So we have the training package sitting there on CFA's learning management system around engaging with people with a disability. So that's a win. And but you're right, there's a bit of work to do there. And I think there's some more solutions internally that I can work on as well. So I'll put my hand up a little bit and put myself up for that internally to try and drive a bit more change within CFA. It is happening. It just needs sometimes a little bit of a nudge and a push. Thank you.
That is absolutely fantastic, Angela. We'll hold you to account. You can report back next year. But I do want to acknowledge also, of course, that CFA is in large part a volunteer organisation. You've got people volunteering huge amounts of their time to do amazing work in keeping our community safe. And the fact that a volunteer would even, set aside additional time to undergo training and to think about these things is really a credit to the organisation, and huge thanks to all of the volunteers. Christina, what about your suggestions for us?
Well, unsurprisingly, I'm going to talk leadership at you. But I've got some clear suggestions, and rather than being on the advisory groups, I'd like to know where are the 20% of people on local government councils. We don't have disabled people in politics in Australia. We've got 4 people across all of the parliaments of this country, 4. And none of them are in Victoria. So we've got a situation where it is so unlikely that the ministry or the cabinet will actually have a disabled person inside. It's just not going to happen yet. So we need people to think in terms of how do we get disabled people into those decision-making spaces, into the parliaments, onto the local councils, onto the boards that make the decisions, into the executive teams where the money is being allocated so that the resources are there. If people with disabilities are in those spaces, we can't be forgotten. So we need to be in those rooms. The reason why we need to be in those rooms is so we don't get what happened nationally. There was no mention of disability in the pandemic plan when it was first written by the federal government. It took 6 weeks of very serious lobbying from disability representative organisations to actually get a national plan for disability up for the pandemic. So that's what happens when we're not in the room. So it's about being in the room. It's about being elected to those places. It's also about being in those rooms, the boards and the executive teams. So it is about the mayor or the deputy mayor. It's about the, the person running VCOS. It's about all of those sorts of people. It's about, 20% of the Victorian cabinet being disabled people so that we're in the room. There's also a really big need for a lot more talking with those representative organisations beforehand. I mean, we've already covered the fact that we can't wait till an emergency, whatever it is, happens before we start to notice that disabled people exist. So we actually need those representative organisations. And the Disability Rights Treaty talks about representative and advocacy organisations need to be consulted. They need to be there. They need to be saying, hang on, you're developing a document with no mention of disability. What's going on? That needs to happen before the emergency hits. Otherwise, it's too late. And that segues into my third really serious suggestion, which is that we need to get better at going into the segregated places. We talk about, and emergency responses often talk about disabled people having the conversation, let's be ready. But what Adrian and I know, because we've worked in advocacy, is for people who live in segregated environments like small institutions, group houses, those sorts of places, people who are presumed to have someone else looking after them, they don't get involved in those conversations. And come the emergency, they are not asked and they turn up and nobody's thought about them. And they require much more support and they require much more adjustment. So we need to think about how we're engaging with those segregated people, the people we don't see out and about in the community, the people who aren't volunteering with our CFA and other services. So we need leadership so we're not forgotten. We need to be in the room. We need to be talking to the representative organisations in a much more robust and ongoing fashion. and not just about disability, about everything. And we need to be making sure that the people in segregated environments are not forgotten. Of course, the answer to that is get rid of the segregated environments, but that's another panel discussion for another time, not for today. So they're my suggestions.
And what fabulous suggestions they are, Christina. And I know you've got an article coming out soon that that expands on some of those ideas, and we're all looking forward to that. And I'm sure Daru will provide a link to that article for those who are interested. Great.
For everybody's information, it's actually published today, so it's it's on our website, and I'll provide the link so it's available to everyone this afternoon. Yep.
Wonderful. Thank you so much, Christina. I think each of those suggestions are so mostly eminently achievable, and certainly something we should all be striving toward and looking toward doing. I'd just like to reflect a little bit on what we've heard, and I think a lot of what we've heard and seen today has been about relationships between people with a disability and their peers, between people with a disability and those organisations that support them, between people with a disability and researchers, advocates, emergency service organisations, local governments and others. We know that emergency management is only effective if it truly works with everyone. And to date, that hasn't included people with a disability. I think today has really presented us with an opportunity to start to work collectively to change that. I think we should build on this relationship between the people here in the room today and the people that have been listening and watching online. I'm really looking forward to the issues paper that's going to come out of today, and hopefully to continuing to work with all of you to identify real and practical changes that can ensure people with a disability are included, are represented, play an active role in, and that their needs are met in all aspects of emergency management. I did think we were getting some questions from attendees. And something's come up on my screen. If I can just read it, my eyes aren't very good. Practical preparedness plan is essential. However, I'm sorry, I actually can't read that. I'm going to need somebody to read that out for me. Adrian's going to do this for me. Thank you, Adrian.
A personal preparedness plan is essential. However, doesn't it put unfair burden for safety back on people with disabilities? Shouldn't the emergency response system take greater responsibility for those most at risk?
What a fantastic question. And I know that each of you will have a response to that. And I'd really like to offer each of you the opportunity to respond to that. Christina, I'll start with you.
A quick response, yes. It's what we call ableism, to put it back onto the, disabled person to fix the world not being okay. So it is actually up to the systems being structured and the decision-making forums being structured beforehand to be ready, rather than the responsibility of the individual disabled person, particularly if they're in crisis, to be coming up with solutions. That is not the answer. It is not okay to actually be expecting a person who might have just lost their house or, found themselves in some very difficult situation to be the one who is required to come up with solutions. Not okay.
Sorry, thanks, Christina. Adrian, did you have a response to that question?
Yeah, outstanding question. Look, I think that's in essence why today is occurring. Essentially, it's occurring because there's been a lack at different areas of emergency and disability being connected. So essentially, that's why days like today are just so pivotal. Yeah, I 100% agree with the question, 100%. And unfortunately, that's what we do as disability advocates, is regularly call out situations that should be, for all intents and purposes, achievable, and they're not, and it's an afterthought. So yeah, outstanding question.
Fantastic, thank you. Michelle, did you have a response to that question?
Yeah, look, I know the NDIS is only one part of the disability sector, but I think, emergency planning, personal emergency planning should be a core element of everyone's package. That being said, there's a lot of people in our community that aren't eligible for the NDIS, and I think government should be working in partnership with emergency services to have the toolkits available and also provide resourcing in forums or supports or training to have those conversations with people, I suppose, outside of the NDIS, and how we can leverage that support in our service sector and the partnerships we have across the service sector, whether it be training, whether it be toolkits, and then to encourage those one-to-one where it's needed supports to help people think about emergency management planning and what will work for them and what their needs are. So to have a much more robust resource, kit bag in our communities to support that really important work, because it's not just COVID-19. We've got 6 months till the next bushfire season hits. What does our ERCs look like in a COVID-19 space, and where does people with disability intersect with that? So there's a lot of work we need to be doing in this space right now to prepare us for what our emergency responses are in a COVID-19 space, because it's a lot different and it's going to be a lot more challenging to provide relief and supports in COVID-19 than it ever has been before.
Thanks, Michelle. Christina, you just wanted to make a quick point?
Yes, just a small postscript there. Can I make it really clear to people that the NDIS only covers 10% of the disability community? The other 90% are out there using mainstream services and supports, or they don't need regular stuff and they occasionally dip in when things get bad. So the NDIS is not set up to be the disability solution for government. And I've been extremely disturbed during the pandemic and previously during the really bad bushfire season to hear the federal government particularly continually referring to the NDIS for answers, when in fact that's not the purpose of them at all. And as an individual NDIS participant, and I am one, it's almost impossible to speak to them in a hurry and get something happening. That is not what they're there for, and it's not how they operate. So we need to be doing the preparedness, we need to be there before. The NDIS is almost the afterthought, the emergency, and frankly, they're not really good at that either, because they can't be, it's not what they're for. And it's only the 10% of us who are actually NDIS participants who have a call on them anyway.
That's exactly right, Christina, and thanks for that reminder. Angela, did you have an answer to that question? Thinking about some of the emergency management principles around shared responsibility, I guess, which
that is my exact note. Well, Bridget, you read my mind, but I've got written here, I can even show you. I'd made a big note about, shared responsibility. I feel that in this case, and we talk about this a lot in emergency management, what is shared responsibility? We will do some of it and take on board some of the responsibility, but we need the community organisation to take on board another part of that responsibility, because we just can't do it all. And I think the bushfires were all commissioned back in 2009-10. That's what, after the 2009 fires, that's what they had stated. And so in this case, I would say the shared responsibility is that a person with a disability is the expert in their lives, in their capabilities, understanding their needs. And then in the case of CFA, well, we're the expert in fire safety, and we need to work together to work out what that means for that individual in their own circumstances. But we can't go in and assume, I suppose, everybody's in the same circumstances. Obviously, like Christina pointed out, with different types of functional capabilities, different situations, and whether people have support or not in their home.
Thank you, Angela. Really, really good points. And I think that goes back to a lot of what I was talking about earlier around relationships and the importance of networks and partnerships and organisations and individuals talking to one another and getting on the same page and working together, working collectively to really embrace that notion of shared responsibility and disability inclusive emergency planning, preparedness, response, relief and recovery. I believe we are out of time. I have so enjoyed this conversation. It has been absolutely fantastic. I think this could become a yearly forum. Mel, I'm looking at you because, of course, you don't have enough to do on a day-to-day basis to think about pulling together something like this online. If I could just thank all of the panellists for your amazing insight, for sharing your experiences with us. Thank you so much. Over to you, Mel.
Well, thank you very much, everybody. What a fantastic discussion. So just in summary, we have heard that while we in Australia have some good frameworks and policies that guide our emergency responses, and compared to what's happening globally, we aren't doing too badly. However, there's so much more we need to do to ensure that people with disabilities have the same protections in an emergency as their neighbours, colleagues and other Australians. While we have some great ideas and great systems in place to be able to commence the emergency planning process for people with disabilities, there is no funding for disability advocacy or any other services to take the time to actively work on making and implementing those emergency plans until it's way too late. It's been very clearly demonstrated today that people with disabilities are absolutely the experts of their own needs and need the support and tools around them to assist in making sure that they have the time, space and appropriate support to put plans in place to protect themselves and their families in the event of an emergency. It's time to take this out of pilot phase. The time for trialling and short-term project testing things is well past us. The disasters are here. It's real and it's not waiting for anyone. It's time to take action, make those plans real and put support around people with disabilities without delay today. A whole lot of things have come out of today and Daru absolutely commits to not leaving the discussion here. We want to ensure that this rich information is captured and used as a tool for advocacy to ensure that the next pandemic we face, the next bushfire, the next flood, and that any emergency plan that kicks in is inclusive of all people. My biggest appreciation and thank you goes to those people with disabilities who contributed their stories. Not just stories for today, but those who contributed and relived their trauma for studies, research surveys, the recent Royal Commission hearings, and everything else that has been done in relation to the disasters of 2020. It's all hard, it's all traumatic, but without your stories, we don't know anything to be able to make a change. So thank you. Thank you to all the presenters and facilitators and panelists for your contribution today. You are all absolute change makers and I look forward to assisting you to progress your work going forward from here. Thank you to the interpreters and captioners. Thank you to Show Division for the technology and making this work today. Thank you to my colleagues at Daru for working behind the scenes at all hours to make this work for you all today. You're absolute legends. Thank you for watching. Have a wonderful afternoon. Stay safe, wash those hands, wear those masks, and stay home. Bye-bye.